there, and you'll definitely see it while he's presenting today. You can see the spark in his eyes and the joy through his voice. So if this is your, and also if this is your first class, type first of our audience for today's class. Awesome. We're seeing a lot of love. I love that there's so you guys are giving me travel and Indonesia. Stuck at where we're supposed to be. I have a more appreciation for traveling, and it's always of the world enjoying travel tourist life. And that I was just 3 of his internal medicine series, and this year in 2019. At last year. If so, type in okay, good. So that's probably why you're back here again to learn. Cole's February classes are available. You can do that at a later time. It doesn't really need to be taken in any. And today's topic is emotional, neurological, body mapping acupuncture, and herbs. And see, sorry, I got distracted by the chat. Group is our Watch It free group. Coupon code to gain access to CEUs or to get access to our paid group. Ask for as many times as they like for a family is our third group. All of our online courses of over and includes live webinars such as today's class. And you don't have to pay. Plus, you receive special perks from our industry sponsors as well. And I like green herbs as well as their customers. And the advancement of TCM and provide educational courses that will fine-tune your. Before we begin, I would like to cover a few housekeeping topics. To 6 p.m. Lunch is to 2 p.m. We'll have 4 after lunch. And what you're seeing on your screen, you'll see the video feed and notes are available for download, and you lecture notes. One is 6 slides to, and then under, I'm sorry, you'll find the chat room, and here in the your colleagues who are also attending. If you see an old friend and would like to corner of the chat room box. So you'll see it as horizontal lines. You can have any questions for the moderator. please send a private chat to us so that way we can keep the. And if you have any questions for, and he'll see it, but please mentions it because it cover. He'll let you know how he wants to. In that room, you'll find upcoming events here at E periodically throughout the day. We logged in more than once, so just Adobe does help remove it for you. And if you do video, no sound, no video connection, so that's something that we don't have. These have said that worked for them is if they connect direct. Definitely private chat with us and we can help you to the best of our ability. Is body part, which is part 1 of body neurological and rheumatic disorders, which include immune and infections, gynecological and dermatological. Holistic medicine in 1991. He studied including Chinese, Korean, Ayurvedic, and acupuncture and Chinese medicine from the Pacific College Public Health Clinic, private practice, during the last 20 years. Go ahead and give him a big welcome. Ben?
Okay.
Yes, perfect.
I think I'm using this correct mic here. Yeah, we're on the sound card, so we're good. Going up. Give me somebody to talk to that understands what I'm talking about, at least. To Elotis, Tina, Donna. They've been really wonderful, and I thank them for the opportunity to be here. I also would like to humbly ask your forgiveness, ancestors and teachers. So, questions, please type them in there. So there's there on their website. The anatomical type correspondence, the internal stuff, and then we're going to cover 400 plus, do 100 slides or so. I won't have a ton of time. We might do a sample treatment here and there if we can. And yes, present, I believe, from my wife, and who is interested in anatomy, then a skeleton available. And you know, careful because he needs to not encourage our patients to you know, I think we're safe. My son and had their classroom put him together and study all the bony landmarks. So Snuggles is good too, but yep, Indiana Bones. I saw a whole bunch of new to me. Kind of right to it. Let's see if I can. Nope, I actually have to click the. What is a term that I like to use? Body mapping. We're sort of mapping out idea, and it on from back in the 90s when I was a student at OCOM on Master Tung points, and I sort of simplified distal point technique. If you're not familiar with Evergreen on distal, so I'll type that in for you there, Jacqueline. On the back, so there's all your, we're going to cover these internal medicine stuff just because we're going to be at the hand, and and so there's a smaller chart as well that we wrote years ago. Give a shout out to our ancestors here. We want to order both if you wanted a chart as well. The book, briefly, correspondences, opposite side of the body, and kind of the zones of points. I think points are more like, and then some advice about how to seminars. Maybe today we'll do one or two. Put together and used, and a little bit of abdominal palpation. And it will help you guys find that stuff. And so we're using basic images, series of systems. Back in the early first time, he kind of was mixing around a bit, and he kind of added some as the time went by. I sort of fell in love with pairs being one. So on our handy dandy listed there, sort of up at the top. Cross. We don't care so much the time of the day. So that means that whenever you want to in office, sort of in the triangular shape, rolling around there. So we'll get back. On the back, we've got some simple images. I mostly like to use name pairs with. Most likely use the clock opposite pair for head instead of just using head on. And that's a clock opposite. Now, with other images, right? So many imaging systems, microsystems are all the time. So you can take advantage of any one of them that I find extremely useful. Very image for the headache, and I would say because we could use heart 8, to treat gallbladder channel. I would say 9 times out of 10, my patients will choose almost as good, like 90. but heart rate also, I will then if I go straight for the big guns, I have less. Couple of books. I showed you that really quick out of the book. Basically, and they Yang Ming on the arm and Yang muscles, and those actions, origins, insertions. I just love that play. Pain stuff, but okay. So immediate relief is what I look. Quickly diagnose, quickly treat once anywhere. If they're sort of like, it's sort of spot, oh, that's gallbladder, got it. Opposite clock. Close off, we can roll sleeves up to the, have them take the shoes and socks off, and I can pretty much. I really do like shoulder anatomy. I usually don't use so much, so I don't use. Extremely useful, and occasionally with frozen shoulder people, I will go to the hip. But most of the time, if they just short sleeve, we can kind of roll it up and then kind of tuck it in, and I can get to points. Sort of piriformis gluteus chairs. So this is useful stuff. In my clinic, I have 4 tables for people to get their treatment in. So they're laying literally on their back for these kinds of patients, and you can treat in a couple of minutes. Effects are, we're looking again for that instant years or so. Finished. I saw a ton when I was in half an hour. So I just kind of ran with it from there. Theory is what I call mapping the channel. You know, stomach is yellow and orange, and etc. Blue for kidney, bladder, that kind of thing. I had lots of patients when I was. It's on gallbladder channel here, but what if the pain's kind of the influence of that spot on the opposite side, right? If where exactly became very important to know, right? And that this chart went. I pretty much in the future as I get more experience, but. And specifically problems, right? Diseases are diseases of organs, typically, brain or gynecological. And, opposite, you know, that kind of thing's easy. But what about the opposite? Abdominal palpation. I have a version of that I like out of the Nanjing. We'll talk about that in a minute. And there's pulse tongue, usual TCM. Find the release points through the organs, basically on the at this chest image, right? Where's liver channel going? Where's spleen channel? And what's going on internally here inside. So we'll talk a little bit about. So if you had a shoulder pain and it's on the in this case, we're going to over the abdomen. So we'll talk about those. That's kind of anytime you have an organ imbalance or any kind of liver thing, right? It's a very locational. Here's the images again. We're gonna. I'm gonna move kind of fast, so I recommend thorough description. Clock opposite going the up and down and the sideways across, and so name pair names, right? So Yang Ming or channel treats the foot channel. So Hen Yang Ming, right? Large intestine channel. Internal organ wise, that they may relate, but specifically. So I find that if I can follow the anatomy, following those names. That's place to go. So we're going. More effective than channel usually. I usually start mapping things at the bone. Bony prominences. There's a big lump of bone. Femur humerus, okay? And then it's like, say, external rotation, for example. Infraspinatus, right? To external rotation of the leg, piriformis. So those two muscles side, and also action-wise opposite. Right? And that's kind of fun to play with. Because as you look at that, at the two most ends and sort of work your picture of let's go through a few of these for those new. Let me just ask this really quick. Anybody not familiar with got it. Okay, so we'll go find more deeper explanations on previous seminars. So there's extremities, which is hip down, right? Trunk, which is from the head to the third image is just these images on this chart sort of illustrate a little bit, so maybe have my picture in that. So basically the idea is, from the elbow. So as we're standing there four-legged, or if you look at your feet are both on the ground, so those relate to each other. So those anatomically relate very well. the sorry, shoulders, ball and socket joint. Elbow is a hinge joint, right? Wrist, complicated multi-bones, right? Big toe, kind of some of our ancestors, right? As feet, right? So they can grip and climb around. And so we needed more so we can lift and push off. And it's a little interesting trying to figure out the anatomy correspondence between where is the big toe and where is that on the very common with arthritis. We're going to talk about is classic. So at the bottom of the thumb, but it's also our handy dandy. You look at the big toe here, it sort of ends. So that's not at the ankle. So then you go, oh, do I needle at the, it would be the bottom of the metacarpal. And what do you guys think? Yep. Needle. Ankle. Metatarsal. End of the metatarsal. Close to the. It's both. I find it to be. If unsure, because it gets very tight down here, it's both ankle and metatarsal. I get both. Because space between where the metatarsal ends and the ankle. 5, liver 4 sort of area. 2, spleen 4, and then I find a point. I call it as a flat spot there that you can needle under a tendon if you wanted to be honest. So that's liver 3, and I call it 3.5. Sometimes one will work, sometimes the palpate for tender spots. A good rule to start with is the tender spot, right? Palpating. Mm-hmm. Push on the point and then have them move. One that changed the pain right there on the spot. Yes, excellent. Okay, the basic anatomical. Because we may not want to needle or needle their shoulder to treat, etc. These images have. I number the joints. So number 2, elbow. Number 3, shoulder. Number 1, over. So that means that whatever wrist related to is going to relate to ankle. Like that. That stays the same. And then now you can use wrist, right? Instead of having to go to the shoulder. Points to treat the shoulder. So shoulder pain is perfect. It treats basically Yangming 14 right at the end. 38 lines up perfectly. Explain very nicely. So that's extremities. Every reversing around. Good, good, good. Okay. Now we're going to get with the rest of the body. Okay. So the rest of the genitals and top of the head. That's everything else that's not extremity. To an arm or a leg. So basically the first way to as head, and we can use our hand as head, okay? We're pretty solid here on the head. Head and neck are moving, right? So that's the part that, right? So that's the first break. I find that typically, to get specific on it, right at the wrist 9 or large intestine 5, at the top C1, right? Gallbladder 20 area. Heart clock, gallbladder heart, right? Okay, so I've run down the wrist. So by the time you get to the base of heart 4 or lung 7 area, depending on which channel we're treating, yeah? Okay, so then as you back upper, see, we can bend at the waist, right? We've got like flex elbow, right? And then from elbow all the way down to the bottom of the coccyx. Out first, okay? Everybody good so far? Wrist can relate to hip, yep. Okay. The leg, okay? So let's rotate. Flip it up like this. So just foot, and it's really nice. Right? The back of the calcaneus of the Achilles tendon, it's very similar to the attachment of muscles on the occipital protuberance. Very nice to treat each other. Here, maybe on the top of the head for the very bottom of the heel, that kind of thing. And then here's the ankle movement. So that of the skull. So bladder 6 is going to sort of be right at the base skull area. And as you go down the neck, just like on the wrist, go towards liver 5. Six, but into the muscle there. Then you're sort of at that sort of the kidney 3 to 7 area. Okay, as we continue down that is going to bend. Bladder 40 area is going to relationship. Classic point for treating low back pain. Of course, it lines up exactly. It's going to be from the L2 navel level down. We may not want to needle this thigh area to treat these abdominal. Okay, so that's easy. All right, so that. So far, so good, everybody? Bladder 40. Bladder 40. L2. Yep, good. Okay. Following along. Numbers, okay. Just like we had a reversed image with our extremity, we have a reversed image. Again, we're going to take our 3, and then 1. Instead of wrist relating relates to the movement. So shoulder joint onto the actual sort of headache area, fat shoulder, right? And as you go down the neck, across. So LI 12 and 13, if those of you familiar with Richard, and it lines up kind of directly going to be navel level, which it sort of lines up the forearm. And then finally, wrist joint is going to pelvis, external genital, right? So you've got fingers you can use. Basically the same, it's just as external version of genitals, you can still use hand. Same idea, same image, it's just the image basically folds at that 1 through 3, SI3 specifically, kind of like do 1, sort of the base L5S, right? Small intestine, bladder. So far, so good. Oh, I would match up channels, but it. Sojin doesn't. Let's just see really quick. Sojin Amaric. I don't know if I'm familiar with the name of. Okay. Same flip over, right? So we had, before we had the ankle as the neck. Well, the foot does the same thing. Just so now the hip comes up onto the pelvis. Flat bone of the pelvis relating with. He's gonna get sick. Oh. Joint gonna be hip body. So this is gonna be upper back in this upper. Camera down a bit, guys. Okay. Wonderful. Is going to be still right? That's knee, so that's bladder 4. This lower leg, that's going to be borum, and the treated very well with these bladder points. And as we get to ankle, at the hip, and then our foot just, it's like folded up inside genital also. Kidney channel. I personally like kidney channel for genital because it's that I think liver is important with. So we of the genitals themselves, but the essence of them, the ability possibly, which will 2, kidney 6. Maybe we'll demonstrate that today. 41 maybe, belt channel, lines up ankle at the foot kind of laying up onto the torso. You can see how it just releases that whole side, and over here into SI joint maybe. Towards the inside, it gets a little bit of and then perfuses into the genital. So gallbladder 41, very useful. Flood area, right? Okay. Bar. Mm-hmm. Great. Okay, last added the front and back image. So really quick on the torso, front easily. Mr. Bones is fun little. Is exactly as we basically what happens is if there's directly behind, right? So it's literally a front to back like this. Or if there's spinal pain in the lumbar, you can go directly into those conditions where we need spinal issues. Face does behind the eyes, nose and mouth. Really wide in the front, and then it's malleable and stretchable and this elastic activity in our imaging, right? With elastic band, if you will, is having to do hand points or foot points for head or up onto the torso. So in this particular image, the easiest way to see it, and if you put the whole head and you map it on the leg here, and the nose is like this tibial. On a younger person, maybe they call that Osgood Schlotters. Such a great word. As the stomach 36, spleen 9, classic for treating. Stomach treats itself. Yang Ming. Large intestine, so that's name pairs again. Head, the face, okay. Mouth would be sort of ankle, middle of the lower leg, and it is a, and you can sort of pick right on the side, sort of something like that, okay, or the specific, or like joint here, so gallbladder 34 or classic for treating, the musculature. Chin ends at top of the head is top of the hip. Okay, so that's the head on the leg. The shoulder, forehead is basically the crease at, when we're talking about our bladder channel, there's bladder channel, there's bladder is going to be heart. There's heart 3 at the channel is pericardium, so pericardium, right? And then bladder channel on the inside. So you've basically got the whole eye covered. for bladder, 1, 2, 3, and it opposite side. So you needle this one to treat that eye. So if somebody just has an eye problem, opposite side and call it a day. The eye at the elbow. So that's the forehead. Again, nose is going to nose, right, just like on the leg. And then mouth is going to be open, sort of forearm here, or mid forearm. We've got eye level, nose level, right, as we go down the forearm, down. So now you can get sort of deep sinus, you know, pericardial, and then also mouth, tongue, right? I think taste issues I treat with like needle into these points, which gets deep sinus. Also can get deep if you needed to. Again, ends at the wrist. That's the first image. How do you reverse it? Very good question. Just like we've been doing. So the joint, the head is wrist. So the very top of the head, you treat forehead, right? Eye level, still the elbow. You notice how the elbow knee, the elbow. As you go down the humerus, and then chin is going to end. For ease of, and there's your forehead, right? Keep flipping the images. Sometimes it's a little hard to say why people have been postulating these images, I suppose. So I usually use the distal. Things not working, then I might start. Leg does the same thing. So let's get back. Right? Three joints, ankle joints. So one end. Now top of the head is ankle. But now nose is stomach 34. It's going to be somewhere in the middle zone of the hip. So they're confused on that. And where is ear? And ear I find to be part of the ear, but then ear is also, if you look, so I find it ear to be both eye level. So two different points. So if you look at my chart really quick, image right, channel running around the ear, that would be what do you want to call it? That I go, of course, opposite clock, and if you the clock triple warmer with anyone to the neck level, and since spleen is on the leg, we're down on the leg. example, thank you for asking. So if we do the whole, we said was knee, so also treats dampness, which is usually the internal eustachian tube, maybe have dizziness. And then if we want to get a neck, right, and head being foot, neck being ankle, we're going to be right at the very top of the neck. So we want to be right at the crease, spleen channel at the crease of the ankle. Anyone? Spleen 5. So spleen 5, spleen 9 is usually my combination opposite side and ear problem. Very useful for me. That's usually my go-to. Sometimes I'll throw in some kidney points too, just to be, you know, because we have our internal pathways, etc. But usually the spleen 5-9 is my way to go. Frequency of treatment. Usually I have people. I do like kidney 3 as well, Anjali. Yeah, and I'll explain why. Usually infection related. We'll get to that one in a minute. Frequency of treatment for me, I usually treat people that are in a lot of symptom frequently, and then as they improve, we space the treatments out. So somebody who, let's say, just had a car accident, lots of pain, I'll treat them 3 times a week for a week or two, go to twice a week, and then as they improve, we go once a week and then once every 2 weeks, and we space out. We let their level of symptom guide how frequently we treat them. The ideal situation for me is to treat them before the symptom gets back to where it was to begin with, right? So if they're better for, we treat them, if it's completely gone for a day or 90% improved for a day, the second day it comes back 20, 30%. By the third day, it's, you know, 80, 90% of the original amount of pain. I want to treat them on that third day or before that third day. So we can kind of keep ahead of the body re-stagnating, I guess is how I would like to put it. Yeah. So we want to keep that circulation ahead of the stagnation that the body's trying to do. We find that the people, the more recent their injury is, the quicker that happens because it's not stuck yet as bad. It's just it's a new stagnation versus an old stagnation, which has layers and body mechanical sort of compensation and a whole bunch of, you know, cans of worms, right? So great. Mix and match images. Yes, you can, Kasra. Good question. You can mix and match all these images. They are all there all the time, and it's just up to your own creativity to take advantage of all of that at the same time. Yep, absolutely. Great. So far, so good. Great. Any questions on those images before we continue on? Images, channels, perfect. Off we go. Okay, clock opposites, name pairs. Okay, and really quick for memory purposes, for the extremities, the name pair relationships are my favorite and mostly what I use, almost exclusively, and anatomical if I can figure it out, which usually we're pretty good at that these days. And then for the rest of the body, the torso, we're using clock opposite on the opposite, again, both opposite side, clock opposite side, and that's pretty much all I do. I will occasionally use name pairs for torso as well. Let's see, and then same channel is the last one. Same channel means same channel that's affected. So gallbladder channel headache, using a gallbladder point distally. Still using the same images, but same channel. And if you're using same channel, it would be same side. It's as if there's a whole bunch of stagnation and it's in a funnel and it's stuck, right? The funnel tapers down and there's like a little hole for all those beans to drop down, all that stagnation. And so you got to pluck the bottom out and then everything drops down. And so that's kind of like what I would call channel draining. Yes, so channel draining, and that would be same side because that's where that channel is. The channels aren't crossing over, they're just going down that same side. So gallbladder channel, if you're treating with gallbladder, same side. If you're treating it with opposite clock or with name pair, that's going to go opposite side. Okay, hope that's clear. I do not use the interior relationship so much. Emerick, occasionally I will with internal organs because, you know, bladder, kidneys are related. Bladder problems, I'll use a kidney point. Kidney problems, I'll use a bladder point. But usually it's more about where the channel's going. So we know the kidney channel goes into the bladder, so I'm using kidney points. not because it's related to bladder, but because the channel goes there, right? So for me, it's more channel driven than it is internal, external driven. Do and Ren, good question. And that's that front to back. So Do and Ren treat each other, or do top to bottom, that kind of situation, along the microcosmic sort of idea. We find that opposite sort of do channel. So, if it's top of the head problem, you can use coccyx, or coccyx problem, you can use top of the head, right? Okay. We will keep rolling along here. Concerned with the direction of the needle. Not so much direction of needle. I just want the area around that point stimulated. So, for example, if you look in our book, I've got for example, I've got a zone, right? So here is kidney 27 to lung 2, and it's a whole band for me. So I will needle, when I say kidney 27, what I mean is that whole area I might needle. Very carefully, there's a lung under there, guys. So we want to not puncture lungs, thank you very much. So we want our needle to be very carefully needled, very close to the bone, and just delicately under, between the first rib and the clavicle, as following, and that needling goes really transverse along. We're not going straight in here. We're going transverse across and just catching the edge of the muscle called subclavius under the clavicle as we go. So I don't care which direction you needle that, as long as you're not going towards the lung. That's really all. I'm worried about the safety of my patient, and I don't want to be puncturing lungs. Or hear that somebody was taking my class and punctured a lung because of what I told them, because I definitely said, be careful of the lungs. We'll get to iatrogenic disease tomorrow, and lung puncture is the #1 cause of death from acupuncture, by the way, if you didn't know. Okay. When you say the needle, what book is that? Oh, that is the book that my book, BodyMapping Acupuncture Technique, in the spirit of Master Tung. Evergreen has it. You can get it from them, or Amazon, et cetera, et cetera. When you say you needle that whole area, do you select a spot? So it depends on what we're treating. Usually I use this area to treat inguinal ligament, right? Opposite side. So I'm palpating down inguinal ligament. If the pain is at the anterior superior iliac spine, then to me that relates to coracoid process. So I'm going to be right there next to coracoid. If the pain is in the middle of the inguinal ligament, then I'm going to be traveling down that subclavius. If the pain is at the pubic tubercle, to me the pubic tubercle is at the sternoclavicular joint. And if the pain is at the pubic symphysis, then we're going to be right at the manubrium, right? So as you go central, you would just end up right central. What about, let's see, I avoid chest points with very thin patients. Yes, I would, yeah, I'm just extremely careful with them, yeah. Let's see, what about thoracic outlet? So yes, thoracic outlet, usually I'm treating neck muscles. Previous seminars, we've covered that sort of at length in the book. I talk a lot about it. More heel pain. So yeah, other pain stuff we did on other seminars, guys. This one we're gonna do more. I just kind of wanted to go, review these things. Heel pain I often find just really quick at the heel of the hand, if you will, and that's basically just above heart 7. Pisiform bone is usually what I needle, or the top of the head, occiput we talked about as well. Yeah, that becomes very useful in what I'm doing. Why don't you use reverse image? You can reverse the image down and try those points from here in the wrist. I just have not seen it release the inguinal ligament or treat pubic tubercle nearly as well. Like I get a 50-50 on that, whereas up here it's over 90%. It's almost every time. Okay, we're gonna move on, guys. Lots to cover. Okay, and we've talked about all these guys. Here's example 1, throat pain. Okay, so throat pain, since we're doing internal stuff, we're going to be talking about thyroid when we get to endocrine system later today. So we've got throat in the middle, that CV channel throat, and then we've got stomach channel on either side. You might argue large intestine channel farther out, but that really isn't as related to the throat itself to me. It's more going to be specifically stomach channel CV. Though, Yang Ming, we've got stomach and large intestine relating with Yang Ming, so we're kind of going to get large intestine anyway, because we're probably going to do stomach distal points, or we're going to do a large intestine point to treat stomach, or we're going to, something like that. So What do you think? Let's see. That should have clicked. There we go. So it is torso image because it is the neck. So we're going to go neck level, torso image. So here's head, here's neck. So we're going to have a point somewhere on the wrist area or ankle area, right? Head as the foot, ankle as the neck, and torso image. I'd already told you, clock opposite for me is my favorite with torso image. So we're looking for a clock opposite pair that relates to channels we talked about. So stomach channel, clock opposite. Okay, chime in and type in, please, when you know our clock opposite pairing. Again, we said head, neck. So we've got neck area here in the wrist or ankle, right? Pericardium, thank you everyone for typing in. So we're looking for a pericardium point. That's going to drive us to the wrist specifically because no pericardium channel on the ankle as far as I know. So we're going to be doing a pericardium point somewhere around this area, PC7. Thank you, Cynthia. Yes, it is, stomach pericardium. And then for CV, we can use GV directly behind. So PC6, 7. 6 is going to be a little bit more base of the neck here, like CV22, and 7 is going to be right up kind of under the chin area on stomach channel, and then anything in between, you can just sort of vary your location between 6 and 7, okay? And then as far as the CV goes, we just go directly behind and find points on GV channel, somewhere between 14 and 16 should work. Yes, you can treat rashes. These are all locational treatments, which means anything in the area that's a problem is treated with these points. Basically, what I think is happening is we're just increasing circulation. We're basically just giving the body a little guide. Hey, go over here and pay attention to what's happening. And then there we go. Language, yeah, anything you think is happening at the neck. If it's a speech issue, usually that has brain issue things to go with it. So then we might have to worry about, back of the brain, back of the head, brain speech zones in the scalp, which I use and we'll talk about when we do like MS and brain disorders. Okay, ready for example 2, guys? Let's do these examples and maybe we'll take a quick break. Uterine pain. So we're going to talk a lot about gynecology a little later today, maybe this afternoon. Uterine pain is in the abdomen, so let's have a quick look at our abdominal area. So let's go this way. So I'm trying to zoom in here. There we go. Look at our abdominal area. So we've got kidney zone, we've got liver, we've got some stomach, right? CV, of course, maybe spleen. Spleen is a little outer. I think spleen is a little bit more uterus for me, but more ovaries. But it's possible that it catches the edge of the uterus as it fans out in the upper part of the uterus. It might fan out and spleen channel might get the edge of it there. But mostly stomach channel, kidney, CV, maybe a little bit of liver on the action. Like if the contraction, say, wouldn't happen, I might think, okay, the action, movement, liver's in charge of movement, the channel can go there. We'll treat that with liver. But in this case, we'll talk kidney, CV for uterine. Torso image again, right? Here we are on the torso. So again, clock opposite, right? We're going to go clock opposite pairs. So clock opposite kidney, anyone? Lower abdominal level is going to be, right, either upper arm. So if we have the whole body on the arm, head, right, neck, upper torso, navel, lower torso in the forearm, the upper arm, or we can reverse the image and down it goes. So head, neck, right? Upper torso. Let me stand up really quick, right? And then lower torso as we go down, right? And then it kind of cuts across this way. And then this lower arm area is going to relate with this area in the uterus, right? So we got lower forearm or lower leg for the same reason, right? Relates. And then of course we've got genitals, hand or foot. So there's a couple of options here. And then we just want to match up our channels. So we got large intestine channels. Yep. So kidney opposite clock, large intestine. Let's see what we got. And CV with GV, right to front to back. And so LI 6 to 8 area is going to be that zone of the lower abdominal. I like it a lot. And then Lingu is one of Master Tung's classic points that's kind of between the metacarpals from LI4. It's a little bit more kind of at the base where the metacarpals meet. Think like liver 3, a high liver 3 on the hand basically is lingu. Okay, so we're going to do lingu, and that's going to be sort of genital, large intestine opposite clog with kidney. Very useful point for any kind of genital issue, uterus, ovaries, testicles, penis for men, etc. And then GV 4 and 3 is right behind, right? So front to back on the GV. Great. So far, so good, everybody? All right, on we go. Example 3 is, clicking along here, I'm not seeing much happen. It's probably going to zoom all at once. Could you go off of Wi-Fi? Because it's slowing down a little bit. Okay, great. Great, so here we are, thumb pain. So thumb pain, lung and large intestine. So we talked about thumb a little earlier, right? So we've got a lung channel, right, up this side of thumb, and we've got large intestine channel at LI5 and running this side, right? So LI5 area, lung 9 area. I'm going to say we're going to deal with pain kind of right in that area. And then, you know, the opposableness, which we don't have on the foot, but like we talked earlier, the end of the metatarsal, end of the metacarpal, also here is at the wrist, so we're also going to need an ankle point. So we're going to need 2 spots on the foot for the one location of pain here per channel. So we might need lung name pairs, right, with spleen points, and we might be large intestine name pairs, yang ming, with stomach points. So that's spleen 5, stomach 41, threaded under the tibialis anterior tendon. That's a great point for the wrist part, ankle. And then as far as the, you know, the upper part of the joint where the metacarpal, metatarsal ends, that's going to be more like the spleen 4, kidney 2, and then possibly stomach 43, but anatomically stomach 43, 42 doesn't really line up, does it? That's kind of more between these 2 fingers, isn't it, anatomically? So we might use a liver point there, maybe a liver 3, it would be a little more accurate, right? Does that make sense? So when I find that these channels don't relate exactly anatomically, the anatomy for me works better almost every time if I figure it out right. And again, we're looking for that instant result, right? You put the needle in, they move their thumb and say, it's better, or it's not better, or it's a little better, right? I'm trying to get at least 50% with everybody that walks in that has pain that we can find on the spot, right? Sometimes they come in and say, it doesn't hurt right now. Sort of like your car, you know, hey, you know, mechanic, it's making this noise. It's just not doing it right now. So it hurts when I do this, but it's not doing it right now, right? That's the funny thing. So name pairs, extremity image, right? Hand to foot, wrist to ankle, as we continue on. And lung, spleen, large intestine, stomach points, right? Thenar eminence, the woohoo. Yeah, I don't use those so much, but you could on the foot. Yep. And spleen 4, liver 3, and that's why the liver point, because it's more anatomically related with the big toe, the thumb, and then spleen 5, stomach 41. And those are usually a thread. Okay. So far, so good. Locked fingers. Very nice question, Amber. So that would be like a, you know, like a trigger finger. Treat a lot of these. This distal points actually work great for my trigger finger patients. So I figure out what tendon, you know, which finger it is. I usually go to the foot, a needle on either side of the tendon. So usually I'll do it from the top because it's less painful than needling, you know, the bottom of the foot. So I'll needle on either side. Say it's the middle finger, which is really common in a lot of my patients. I'll needle on either side, the top of the foot, and put my finger under the foot and penetrate down until I can just feel the tip of the needle on the bottom of the foot, nice and slowly, so it's not too terribly painful. And that's basically getting on either side of the tendon, and it seems to release the pressure, and the trigger will ease just right on the spot. You can, if that's not working, needle directly under the foot and go right down that toe and go right into the tendon, and that will directly get this tendon on the finger. So that's nice. I usually leave everything in about 45 minutes. 30 would be my minimum, 30 to 45 somewhere. And I have them move the area that's in pain usually when the points are in. Okay, so moving on, guys. So that was the examples. Let's continue on. I'll do a quick, we'll get partly into the abdominal stuff, and then we'll have to take a little break. So first and foremost, the abdominal zone, hara zone, if you will. I'm calling it these days. Let's see if I find it in my book. We've got it in the book here as well. And it is right here, right? A little bit bigger image. Okay, so we've got, I'm getting flashes and breaks in my camera here, guys. Sorry. I hope I'm not freezing too much for you guys. Am I freezing for everybody? No. Okay, great. We'll keep rolling then. I'll just not see what I'm doing so much. So abdominal zone. So we basically got stomach in the front. Let me bring this down a little bit. Right. So we've got stomach in the right in the very top is stomach. Also stomach at CV12. So there's kind of two areas of stomach zone. At the navel level, we've got spleen. Okay. Then we've got large intestine on either side, basically the large intestine, the ascending colon, right? Transverse colon, descending colon. So we've got large intestine on the left, large intestine on the right. Liver, of course, is at liver. The immune point or lung is at the basically where the appendix is, lower right-hand quadrant. There's another spleen zone, so spleen in the middle, also upper right quadrant where the actual spleen and pancreas are. That's the spleen too. Again, large intestine, descending colon below that at navel level. And then one more down is what I like to call liver crossing. It's sort of like the liver area has a spot over the liver itself. Then there's another kind of liver crossing zone down here. That's kind of classic in a number of systems. You might have seen different systems in the Japanese style, and I find those are great too. This is just a simple, easy one for me. I don't have to get too involved with it. We have a release point for each one of these spots, and we've covered those in other seminars. So, okay, on we go. I found that in the Nanjing, there's, if you look at Unschuld's book, I've even put the page numbers here, they've got a little description of where these abdominal zones are. So they have liver being listed as below the ribs on the left side. So if it was my left side, that would be over here where the pancreas is. That doesn't really make that much sense. So what I figure is they were saying the doctor's left. So as you're looking at your patient, under the ribs where the liver is. That makes a lot of sense. And so I think that in that frame of reference, it made a lot of sense that maybe they found a left side lower liver location, which it does. And then heart above the navel, right? And then below, kind of above the navel, below the heart. So right there, I think I called that stomach earlier. That's actually heart. And let me just click back really quick. I didn't have it zoomed in. Yeah, that's actually heart, but it's going to get the same point as the stomach zone. So heart right under the xyphosternal notch, stomach zone of basically CV12, and then spleen below that. Oh, a kidney right in the middle at the CV channel, which is right over the uterus for women. I've even had prostate patients where you'll palpate there and it's tender. So that's kind of interesting. Spleen channel, of course, and this just gives you a description of where these zones are. I think the Japanese systems that I've seen and used are more refined. I like the simple one just for ease. It's very quick. I can throw in the points for that. Go back and check the abdominal again. Almost all my internal medical patients, I do this abdominal palpation and treatment. I get almost immediate changes on these zones. I put the point in, it's a release. So the points are listed in the book, and we'll cover them kind of as we cover each condition and zone. Right? Great. Diagnosing internal, it's great for diagnosing the problem. I try to, match up pulse, tongue, zone in the abdomen. They don't always match. I don't always get what I want. Parents have been telling me that for years, though I keep trying, right? Got to keep trying. We're looking for tight or tender mostly. Some patients, it'll be empty, right? Okay. And then immediate effects, yep. So here are the points listed for you really quick. Heart area gets PC6, okay, either side or bilateral. Typically, I'm doing them bilaterally for this zone. Stomach area gets the same thing. Liver area, the upper traditional liver area at the liver itself gets a same-sided liver 4 which I find to be the same as spleen 5. It's a large zone for me, and I find liver 4 spleen 5 to be a whole area that you're on both energies, liver and spleen, when you're needling in there. And that's the upper right quadrant, same side. As we continue, we're going to have spleen is going to get treated with spleen 9 bilateral or one side or the other. For the spleen in the middle. For the spleen on the left, which is the one that's shown here, that's going to be same side spleen 9. So that's the left upper quadrant. Pancreas, it could be the spleen itself, an immune problem, right? The spleen is full of lymph tissue, so it will swell and have infection possibly. And so spleen 9 on that left side, treating left-sided, pancreas there. Large intestine area on either side gets stomach 36. Usually I do it with 37. So for me, I usually put 2 needles in every time I treat one of these basically stomach 25 points. I just do 36 and 37 together deeply. Usually a full 1.5 inch needle is what I'm using on those. Same side as the area. So if it's the right side, intestinal spot, then I'll hit that stomach 36, 37 on that side. Yes, Frizella is asking about abdominal palpation when they're in a chair, in a recliner. I do actually. My recliners go almost flat, but they're a little bit bent, so I can still palpate abdominal areas there. Yep, you can. I usually find the way I do it is I find the navel, and then I just palpate right through the clothes. So I just look for the navel area, and then palpate spleen in the middle, and then usually I go to the stomach on each side, large intestine zones, and then I go up to liver, over to stomach, check out heart. Usually heart is when they have a heart condition, right? Aorta problem or the heart problem itself. Typically, I don't find it very often. It's rare, only heart patients. And then, upper spleen, and then kind of work my way around down to the lower liver crossing, kidney zone, and then finally abdominal, the immune. I don't think it really matters which order. That's just sort of how I, run around because it's just familiar for me. Their legs are slightly bent in the recliner, usually. Mm-hmm. Yeah. Yeah, I don't, I also I put a pillow under all my patients on the table. So their knees are always bent, but not totally bent up, right? So if you're familiar doing abdominal palpation, hara, you might be used to having their legs bent. Usually mine are sort of semi-bent, basically a large pillow under the knees, but definitely not a full fold. Yep, good question. Oh no, 40 millimeters, so 1.5 soon needles usually is what I use for almost everything. Yeah, you might, Jennifer. Heart reflex, be cardiac sphincter. It could be, there might be somebody who's got like an upper stomach, but typically that's showing up in the stomach zone too. So if stomach zone CV12 is tender and they're tender at the heart, I figure that's just all stomach and not really necessarily heart related. But if I take their heart pulse and I'm finding hesitancy, which we'll talk about later, then I would be treating it. But again, it's the same point that treats both. PC6 gets both of them for me. So I just might focus a little bit more on a heart treatment if I'm finding it in the pulse. I really pay a lot of attention to the pulse for heart patients to judge where their heart is, at least right at that moment. Okay. I think we covered all of them. Large intestine 10. So that lower right quadrant, which is the immune area right over the appendix, basically, complicated down there for women, especially. We've got ovary, we've got appendix, the psoas is right there, maybe a bit of uterus, right? So there's like 4 things going on right on that lower left quadrant. Which one is it when you palpate? I mean, the palpating, that usually there's a spreading sort of achiness. It's hard to know. The intestine, the ileocecal valve, it changes from small intestine to large intestine right there also. There's a lot of things it could be. So typically, that large intestine 10 on the opposite side, which sometimes I'll put a little triple warmer in parentheses next to large intestine because I find that it's a little bit more on the triple warmer channel. So sometimes I'll even call it triple intestine 10. I've heard it called that before, and I like that term actually because it kind of reminds you that it's not necessarily, with the hand in this position, it's not necessarily right on top of large intestine channel. It might be over a half a soon or so towards triple warmer channel. So for me, it's an area, and I'm palpating around for the tender spot in there, the gummy area or tight, tender, that kind of thing, right? Okay. If it's empty, I might treat it too. Usually I'm looking for tender. I think we don't get a lot of true deficiency patients. Almost everybody is overfed, over stagnant, right, in this country. So usually they're going to be tight and tender. Occasionally you'll find somebody with a real deficiency and they'll have empty. You'll just sink right through the spot and there's just nothing. That's also pathological for me. Okay. Somebody was asking, what's the difference between the 2 spleen and 2 liver points? I'm not sure I know what you mean. Clarify, please, and I'll answer that. Hard pulse above the navel. Yeah, the pulses don't bother me so much. I'm looking for tenderness. If it's tender, I treat it. If it's just a pulse beating strongly in an area, I think that people have different areas where the aortas move, and you might feel pulse in different areas. For me, it's not. I'm not using that as a reference. I do needle all the corresponding areas, Sarah. If I find everything in the abdomen tender, I needle all of them. Yep. 2 spots for spleen and liver. Yes, I got it now. So yes, Jerry. So basically, right, there's liver upper and there's liver lower, and they each get a different point. So the liver upper gets liver 4, same side. The liver lower gets liver 4, same side over there, right? So that's the 2 liver points. The spleen is in the center, getting spleen 9 bilateral, or one side. Usually it's bilateral. And if it's spleen in the upper left quadrant, then that's one-sided spleen 9, which is kind of where the spleen and pancreas themselves are. That's how I'm treating those. I hope that made it clear. Excellent. Good questions, you guys. Thanks for following along and being part of it. I don't, for me, the sequence doesn't really matter so much. Sometimes I will find that that immune part is tricky because, again, there's so many things happening in that lower right quadrant. So I might, if the LI10 just doesn't nail it, or and so a lot of times I'll do 2 needles there, it doesn't just release it, I'll release everything else and then go back and check it. A lot of times doing the intestinal point cleared it, or doing the kidney point cleared it as well. So there was some referring happening from other tissue nearby, right? Occasionally it's actually psoas, and so, you know, that's, you got to release the psoas, which look to other seminars for that one, guys. I put them, I guess I might have to demonstrate the stomach 36, 37. I guess they're pretty perpendicular. I might angle them towards the tibia a little bit, but they're definitely deep. I'm almost going the full length of 1.5 inch. So I'm putting them in quite a ways. Pretty much internal patients, all of them. If it's a pain patient, I probably don't mess with it. The internal, abdominal palpation for internal patients. Triple overlapping point. Michael, interesting question. Is the large intestine left or right of navel for the triple overlapping point, left or right from practitioner viewpoint? I'm not following, Michael. I'm sorry. Would you use the same point? Same points for bloating? Probably, yeah. I mean, if it's bloating, pretty much I think that they have intestinal swelling. The tongue's probably going to be swollen. I'm pretty much doing stomach 36 spleen on everybody who's got the bloating. And that just gets the whole center, right? Spleen 9 gets the middle, stomach 36 gets the side, the other stomach 36 gets the other side, the other spleen 9 gets the middle. So you just pretty much treated the whole band across the navel with stomach 36 and spleen 9, so, and 37. So I usually palpate it, find the tender spot, put the point in, and repalpate. So I put in all the points for the abdominal, I go back, check them all to make sure they're released, and then move on. If it doesn't release, I go and make sure I needled it right. So I check my point, I re-stimulate it, I change the angle, I maybe add a second needle, go back and check again. And sometimes there's one area that's not releasing for whatever reason, and I try to figure that out. Sometimes it's just going to take time. Maybe they have Crohn's disease, and there's a lot of healing that needs to happen in the intestine. Hard to say, but I usually look for that immediate change, just like with pain treatment. I do use pulse diagnosis. We're going to get there. Mentioned the large intestine abdominal point had a correspondence with. Oh, right. So Michael, yes. So what I meant was that the large intestine 10 point, I find it close to triple warmer channel. right? So not exactly on a classic large intestine 10, right? For me, it's a kind of a zone. So it's going to be some large intestine, some triple wormer. It's kind of a zone. So sometimes I'll call it triple intestine 10. And again, that point is only done on the left to treat the right, lower right quadrant immune or lung zone. Okay. Great. All right. I'm going to be moving along, guys. We got a lot to cover. So thanks for the questions. I'll try to, if you have another dying one, bring it up in a little while, and I'll see if I can get back to it. I usually just go straight to the depth I want for needling, and I freehand almost everything. I'll show you some, I'll do some needling either today or tomorrow. And these days I've been needling with gloves on, which I didn't know I could do very well, and actually works pretty good. What I found is I have to get a neoprene glove, not neoprene, what are they called? Nitrile, a nitrile glove, and I get one that's a size small for me, which I'm usually an extra large glove size, so I get a large, and it fits really tight. And then I can freehand, and it works. I can even take pulses through those things. It's pretty great, actually. I'm impressed. I'm probably going to be wearing gloves a lot more. Yeah, it's useful. I know other practitioners that they want that touch of the. It still works for me. It's all working. So. Stomach 36, pretty close to the tibia. Yeah, I'm within a half soon of the tibia, I think. And for stomach 36. Yep. But it's a zone. Stomach 36 is big, so it could be anywhere. But I try to keep it close. I know that if I get too far out, I'm not getting the effect I want with stomach 36 and 37 too. Okay. Great. Pulse diagnosis. Someone was just asking. Thank you. You're moving us along. Love it. So George Sludy de Moran, and this is where my first exposure to this version of Pulse was with a student that came through OCOM who was a senior student but needed to get licensed in Oregon, so she had to go through school. Her name was Andrea Lici, and she teaches occasionally. Fantastic diagnostician, unbelievable. I would just spend half my shift following her around and watching her take pulses. She could literally tell you what you had for lunch. It was crazy. And she had mentioned that a lot of it was similar. She was from Brazil, and she said that she got it from a senior Chinese practitioner that had moved there, left China early in his life. So he had some old series. Yes, you're right, break. Sorry, Michael. Anyway, really quick with Sludy de Moran, in his book, it's very, very similar to the version I'm using. So if you want more on the pulse, and it's all over the place in that book. That book is all over. But I might, grab pieces and highlight it at some point when I write about pulse in an upcoming book someday. So we'll talk about it and get more specific into pulse after the break. So quick break, everybody. Let's go. Is 5 minutes enough? I think we got a lot to cover, guys. So. I get rolling and I forget the break. Okay, let's go 5 minutes.
Hi, Cole. Let's do a 10 minutes break, please.
10 minutes. Okay, Donna.
Thank you. Okay, Sam's going to call you.
Okay, great.
Thank you.
Test. You guys can hear me okay? We changed our mic, so hopefully it won't freeze quite so much. Great. Okay, we're going to move along, guys. We got a ton to cover. So I'm going to go through the pulse pretty quick. I'm actually not seeing the slides anymore, Sam. So I don't know what's up there. I might have clicked something wrong, I guess. Yeah, the abdominal diagnosis and release points are listed in the book. Whoever asked that. Yes.
We haven't started the recording yet. Really quick.
Okay.
And Sam says you need to stop the video and do what, Sam? And reshare again because you're freezing.
Okay. Stop. Got it. All right. Stopped. Start sharing. Okay, how's that? I'm still seeing some freezing, but looks better now. Again, I'm not seeing the slides, Sam.
Hi, Cole. Give us 1 second, please. I'm going to actually do a really quick talk to everyone. I wanted to share with them something new that we have on our website. I'm really sorry.
Oh, no worries.
Okay. Can you guys see my screen? I'm sharing it. Can they see it? Okay. Yes, it's slow. Okay, so I'll go a little bit slow. Really quick because only because I think this is going to be super helpful for you today during Cole's class, and it's something new that that recently went live, and it's our TCM points page. And so I wanted to go over how to access it really quick. You log into elotus.org, and then you see right here it says core. You click on that, and it will take you to our core page. And this is our collection of real essentials. It's a resource center. And we have Master Tung Acupuncture, which has been on there for some time now. But now we have our TCM acupuncture section. So you can click on that, and it lists all the TCM points that we learned in school. So let's do lung one, for example. And for the limbs, the pictures are there. Not all the pictures are up, so the torso points and the back points, the images are in preparation. So if you scroll down, you'll see. Oop, that was too far. Applications, the balance method points. So it'll tell you for system 1, if you're using the lung channel, what channel to use, and that would be spleen. So this is going to be really helpful for you if because of the body mapping acupuncture technique that Cole is talking about today. So if you guys have any questions, I will be available for private chat. I don't want to take up too much time because there's so much for Cole to cover today. So Cole, go ahead and take over.
Thank you, Donna. And that looks like a really useful thing, guys. Let's see, PowerPoint's coming up, I suppose. All righty. I see it spinning, loading. Perfect. Okay, I'm going to go through the pulses pretty quick, guys, because we got to get to these organs. So and diseases. Basically 3 jows. So we've got upper jow, middle jow, lower jow. Okay, with the 3 fingers, and it's basically the organs in those positions. Okay, so on this side, it's my right hand. So right hand, it's kind of opposite the side of the body, but right hand is going to be lung, large intestine in the upper jow, right? So it goes channel and then organ, and then channel and then organ. So there's depths to it, and then there's 4. So those are the 4 positions, and then it goes yang and then yin, because yang is more superficial, so it floats. So you got yang channel, then yang organ, then yin channel, then yin organ. So the yang channel is really easy to feel because it's right at the surface. Very first thing you feel is you touch that pulse at that position. And then the yin organ is pretty easy to feel because you just push all the way through and occlude the pulse so you don't feel it at all, and then back up a little bit and you'll start to feel the pulse go by. And that gives you what's happening in the organ of the yin in that position. Right? So we got large intestine channel, a little bit deeper is large intestine organ, a little bit deeper is lung channel, and then lung organ. Same thing here. Stomach channel, stomach organ, spleen channel, spleen organ. And then the lowest position on the right-hand side for me, I call triple warmer or adrenal. And then the deep position, the yin, is going to be PC, pericardium, or hormone. Usually it's more hormone or reproductive organs, actually, is what I find there. So we've got triple warmer channel, triple warmer organ, PC channel, PC organ. Okay? On the other side, we're finding small intestine channel. Usually that's going to show upper back pain for me. Small intestine organ, not necessarily so much show up for me there, but sometimes you'll see some intestinal problems. But heart channel and then heart organ is very strong for me. I find a lot of heart organ issues with patients who are having heart problems. You'll feel hesitancy, sharpness, knotted, etc. Heart attack, kind of gravelly sensations. We'll talk about that. I did that in the last seminar a little bit more. Then the middle position, we've got gallbladder channel, gallbladder organ, liver channel, deeper, liver organ, the deepest. And then here is kidney and bladder. So we've got bladder channel, that's mostly low back pain. Bladder organ, the organ itself, so interstitial cystitis, bladder infections, etc. You'll find stones in there sometimes. Kidney channel, sometimes that'll be ankle pain. And then kidney organ, you'll find kidney stones in there. Sometimes a position will cross to the other arm. So like if back pain is really bad and bladder channel is really wiry, which is usually how pain shows up, then you'll feel wiriness on the chur position here as well. And that one usually, it'll just cross to the other side. So both the left pulse and the right will be the same. So that's basically how I find the pulses, and again, the depths. There's also sort of a superior and inferior to it. So if you're looking at large intestine channel, if I roll towards my hand, just like we have head, neck, right, upper torso, navel, the pulses that are more towards the hand are more upper in the body. So as I roll my finger up towards the hand, I'm going to get more the channel that's towards the face. If I roll my finger down towards the elbow, I'm going to get the channel that's lower in the body on the channel we're on, right? So if it's stomach, if we're in the guan position, the stomach channel, and I'm feeling the very superficial pulse stomach channel, and I want to find sinus or tooth problems, then I roll my finger a little bit towards the hand position, the hand itself, and that's going to show me the upper part of stomach channel. Versus if I roll the other direction, it's going to show me the lower part of stomach channel, right? It's pretty delicate stuff. I've been doing pulses for about 30 years. It takes a lot of time to develop the sensitivity, of course, and I definitely am just a beginner even in taking pulses. And so I keep finding new things all the time. So just take a lot of pulses, basically. Okay. My screen has gone back to just the eLotus presentation again, Sam. So do I just click through? Oh, yeah, there we go. I can just click through the... Okay. Those are the examples. There we go. And here's the... Okay. I had these color-coded. I don't know quite what happened in the transfer of it, but here you've got, I'm showing you right side, left side, and as we go through each one, yang channel, yang organ, yin channel, yin organ for each finger position. Large intestine channel, we've got most of your finding. I'll let you guys read through these. I kind of need to move along and get to our other, otherwise we won't get to any things here. PC channel is deep, organs deep, right? It's triple warmer, being the yang is the superficial. So triple warmer channel, triple warmer organ, spleen, PC channel, PC organ. Basically what I find, I did have a different microphone earlier, yes, Christina. So we switched it because we thought that it wouldn't freeze quite so much. So hopefully it's better. Sorry if the sound is a little bit different. Basically that's adrenal channel, which I don't necessarily find too much in, but when you get down to adrenal organ, to me, that is actually the adrenals. Basically, I kind of feel how well someone has slept recently, because they sort of recharge through sleeping. So if somebody's been sleeping well, then that adrenal organ is going to be pretty weak. Or if they're really stressed out, it's going to be really wiry, right? And then PC channel, PC organ. PC channel is kind of, channel and organ kind of merged together for me in that one. And then you're going to get more of like, where is the reproductive system? So is there a prostate issue for men down there? Is there a, where is the menstrual cycle? How full is the uterus with blood? Is there a tumor, a fibroid? Is there something wrong with an ovary? That's what's going to be in that deepest position on that right hand side. So kind of went through that a little bit. Obviously the rest of it's pretty similar, like I said. And okay, so I'm going to move along from pulses, guys, and we're going to get into organs. Okay. Okay, great. So basically, day 1, 2, the last seminar we did, I covered day 1. We did EENT diseases, respiratory diseases, cardiovascular diseases, gastrointestinal, half. Day 2, we continued, did hepatic and gallbladder, bladder, and then genital urinary. So for this seminar, we're going to try moving along quickly, immune and infections, which is, I mean, that could be a whole day. Gynecology, endocrine, psychological conditions, and dermatology today, and then continue with neurology, brain disorders, which is Alzheimer's, Parkinson's, that kind of thing, strokes. Cancers, part 1, I didn't have enough time to cover all of them, so we'll just cover a lung cancer this time. Iatrogenic disease, which means caused by doctors, and then musculoskeletal. Okay, on we go. So there's some evidence-based information I'm giving you guys. Lifestyle nutritional science. First one is Dr. Greger from nutritionfacts.org. If you're not familiar, I highly recommend being familiar with that. Makes all the difference in the world for patients who are having organ problems related to their food. I mean, all this guy does is read research and then report on it. And he calls out research that isn't good. He calls out research that is good. So he just summarizes for you. He's got a book called How Not to Die, and that's Dr. Greger himself. If you're not familiar with this book, he, like I said, cites every single thing. And so let me just flip to the citations for you. The citations take up that much of the book. So the last almost quarter to third of the book is just the citations of the rest of the book. I think it's the most heavily cited book I think I've ever seen. Physicians Committee for Responsible Medicine is the second one, PCRM. That is this book that I'm using, which is the Nutritional Guide for Clinicians by Dr. DC. He has a medical clinic there. He has podcasts, stuff you can take for free on nutrition. It's wonderful, but all evidence-based. And then we've got the China study. This is nutrition, and that's Dr. Campbell, who did the biggest study, comprehensive study on nutrition ever undertaken, and it was done out of research that came out of China on literally 800 million people and what they ate. To get most of our information. I also went, and they have through Cornell University, Dr. Campbell has a little, it's about 6 weeks, and it's very thorough, very good. Highly recommend taking that. I took that a number of years ago, and it just ups your nutrition. It's going to benefit them. It doesn't cost anything, you know. They're not getting it from their medical schools are lacking in this information, and nutrition schools are lacking as well. Information. I send the nutrition studies, nutritionfacts.org has mountains of videos and information. It's patient's disease, rheumatoid arthritis, for example. And they're just like 5, 6, 7 minute videos. He cites all the research. He brings up all the information. Out of Cornell University, eCornell. It's online. It is the nutrition studies. I like that one. There's actually another course I'm right about to take. In fact, it starts today, and so I'm going to miss the first one. He worked at True North Health Center, which is a fasting clinic in doctor really just puts out the best information he can. And he's got a whole nutrition course that's coming up for 12. Okay. On we go. We're going to cover immune today. And immune system, we're going to cover respiratory allergies. What we're dealing with now, and influenza, food allergies, and a little bit of autoimmune. I'm going to focus on lupus for the autoimmune, but a bit of autoimmune under gastrointestinal. I think leaky gut or excessive permeability of the gut plays a big role. Disease in the previous seminar under gastrointestinal, and a lot of that plays out in all autoimmune patients. Those statistics are autoimmune patients tend to have 2 or more autoimmune diseases. It's much more likely for them. Much focused in the digestive tract. That's such a big key. So probiotics are incredibly important for those patients for me. Okay, on we go. So basically I run down each disease like this. So we'll have etiology and pathology, which most of it is coming out there. The diagnostic, allopathic diagnosis, abdominal palpation for me, pulses that I might find with these patients, all ER. And then we'll go on to allopathic treatment. What channels and images, strategies I'm thinking about. and why those points are being chosen. Any questions come up during these, of course, ask. And then we might have an image like this of the head to describe the areas we're treating, channels, and why. And these, of course, a lot of these are formulas that I like. My favorite formulas, a lot of them come out of Evergreen. I really like their formulas and formulations. And then we just move along like that. So let's go back to the beginning here. We'll go through each disease like this. And copy. Okay, first and foremost, so respiratory allergy. Community, infant formulas bring about this much more prevalence. If patients had been on infant formulas when they were little, they didn't get that immune from mom, and that's immune system for the rest of their life, really. It's amazing. Yeah, thank you, Anne, for the correction. Respiratory allergies, obviously, you're causing damage to the whole lung system there. Infections obviously have a big effect, and some kinds of obstructions, dental obstructions, obstructions in the nose, that kind of thing. Mostly looking at nasal discharge and being like, yep, you have a respiratory allergy. For our abdominal palpation, the immune zone is the one that in upper left quadrant will show up. Sometimes the spleen in the middle, and then it could be any of the other cases. You'll see other organ areas, and I just treat whatever shows up, but these are the most common for me. Intestine and upper stomach channel pulse. So the most superficial pulse on the right hand soon. If you're not familiar with windy, I like this term, windy pulse. I like to describe it as, for me, pulses are almost visual. You can almost, once you, it's fascinating for me to take pulses and really kind of meditate on them a little bit. And you felt the sail when it's full of wind, and you press against the sail, it's kind of tight on the surface, you know, like a taut canvas. Substance behind it, you can just push right through. So that to me is what a windy pulse feels like. You feel it really tight on the surface, and then when you press into it, out of the way. So that's a windy pulse. Tight would be similar, but a little bit firmer all the way through, and then wiry, pain kind of thing, and that's like pain. They're having, usually there's pain involved. Organ, you might find a weakness, so that deepest pulse on that Sun position, so you push all the way down to the pulse. Lung organ, there it is. And how does it feel? Is it weak? Is it empty? Is it slippery? Is it real thin? You know, how much it's doing. Okay, and as we continue on, basic treatments. Great, I might actually start calling it that. Tent pulse. I like that. It feels, you know. Irrigation, of course, you know, they're doing the various netting type pots. I have a comment on that in a second. Antihistamines that don't resolve, but and then channels and images. We're looking at, let's look at the next slide for channels. So as you can see, boom. Hey, look at that. I got a pointer, guys. So we're going to look at large intestine channel, right? Stomach channel, the yellow, is along the side in the sinuses and maybe a bit deep, right? So the stomach channel might be deep to large. Underneath it, layers, if you will. This purple spot, like a little rouge. So he's got some, that's small intestine 18, basically small intestine, which I think if you look at the neck, under the jaw here, and then I think it goes internal and then goes under the zygomatic arch, probably through the trigeminal neuralgia there. A little bit of upper jaw pain, especially if it's the back teeth, I think are going to be related to channel along here, right? All this upper stomach channel. The zygomatic arch itself is going to have some small intestine channel. A bad root canal or something, and you're way up into that small intestine channel, along the back of the maxilla, and then down the neck, right? So that's small intestine where it's going for me. Large stomach takes over the rest of it. The whole and lips, I've got a spleen channel. You see that kind of yellow orangish there, and then the upper sinus here, stomach, and then the eye is going to have gallbladder on the side, bladder on the inside, of course, stomach in the front. I think it splits about much GV directly here in the middle, not much, and then spreads out right to about bladder 2, and then the rest of the eyebrow is gallbladder for me. So that's kind of how I see that. And then triple wormer channel on the 3, and then that whole, it kind of goes up all around Taiyang. That whole temple is the ear, and around the ear is triple wormer, and the rest of it is gallbladder. Again, the internal channel. So all this stomach channel here, stomach channel up here, channel, I think I lost my pointer. As stomach channel runs up socket, right, around the back, and of course with the nerve but around the sinuses under it and above it, and I think that that's where the stomach ache comes in. I think it's the bit of sinus that the stomach ache comes in. So if it's the frontal headache, you got to sort of differentiate. Is it, sinusy stomach? Is it just kind of across the whole front? That's going to be bladder or temples. That's going to be triple wormer. So we can differentiate our headache or symptom. So those are the channels we're all looking at. I like to describe it. It's hard to type all that up, so I just kind of put it the basic ones. Nose and that upper sinus, some maybe that upper teeth. And so, as we're using, if I can get a little image on our handy dandy anatomy leg. So back a little bit, guys. We talked about the leg being the head. So the whole near the eyes, nose is tibial tuberosity, right? That's why we reviewed this earlier, because we're going to be using it to describe these points. Tibial tuberosity is nose, which means just to the sides of the nose. Up. And lose my, there we go. Lines right up. Stomach 36 lines right up. 37. Towards the eye itself, you might come to stomach 35. Right? Stomach 35, 36, 37. That whole zone is this whole zone. Again, happening mostly on the right side, then the right-sided stomach points are going to be the ones you want. If you're doing it, right, if you're doing it more down the leg, right, as you come down this way, remember the whole leg is the torso, right? The head is the head as the foot, right? So if we're looking at our foot, you can see where the toes meet, right? Where the toes meet is about eye level. So as you go down the foot, you're going to be in nose level. So instead of being, 4 is going to be kind of the eye. 43, 42 is going to be more the nose, or because 43 is getting right in the face, boom, and stomach 36 is getting, again, the same spot. It's just two different, the foot, and the other one is whole head on the leg. We can do the same thing. So the whole head is the arm, and then we can use large intestine points. So you can do large intestine eye level, right, at the elbow. Large intestine then 10 is going to be nose level. So then intestine channel, or name pairs, Yang Ming, stomach channel, right? And the same reason for stomach channel is getting itself, and it's also getting Yang Ming pair. Large intestine next to the stomach, they're both Yang Ming. So you really can't go wrong with, and they treat their paired organ. So it's very useful in that way. Whole body on the arm, head as the hand, right? So then large intestine 3. And like I said before, where the fingers bend is like the eyes closing, right? As my eyes close, my fingers can bend. So there's my eye level. And so if we're wanting to be 3 is going to be that highest up kind of bridge of the nose eye level area. And as you go towards 4 is going to be sort of lower down, maybe into the tooth area, right? So you can kind of specify your exact spot by having these images kind of dialed in a little bit more accurately. Intestine points. Spleen points are getting triple warmers. So like the eye level triple warmer, spleen opposite clock, and that's that spleen 9 area gets there. Right, the foot is the head, right? And so there's our eyes are going to be at that level where the right at that same eye level, getting triple warmer channel. So if it's a triple warmer channel headache, or you could use 3, right? They're 2 different images, a head image here or the whole head on the leg. Good. Now, kidney points, a little more interesting. We'll get to that one in just a second. We talked about pericardium opposite clock with stomach a little earlier. Whole head on the arm, eye level again at the elbow, so just below the eyes. Perfect. As you go down, nose levels here, so like it's not quite 4, is it? So like 3.5 maybe. I mean, we could just pick where we want along the channel. So instead of having tape, forget it. The whole channel's active. We can treat anywhere along the channel. In fact, the channel's nice and wide, so you could even get a couple points side. Fill the area with 3, 4, 5 needles in that area. Tons of half, PC4, PC5. We're just moving down the face, right? So, and I think that for or even like the deepest part of the tooth that comes up, the canal of the tooth, the root canal, pericardium points get. The lung points, it's just treating its own channel. So lung channel goes up internally. So we've got a lung 5. The lung 5, lung 7 and 9. Again, as you go down the face, lung channel gets up and inside. Chest level, head, neck, upper torso. So you've got neck, chest, sort of upper. Lung 9 is going to be, again, vertex type headache, or along the. Usually we're more into an infection at that point than just an allergy. The kidney points, before I get to some questions there. So the reason is that the whole leg, right, as the foot, the neck as the ankle, as it moves, the movement of the neck, right, there's 4, yes? Yeah, 3 to 4, perfect. So kidney 4 is a little bit more on this calcaneus, and then this is what I call kidney 4 into 3. It's like a threaded. So you start on kidney 4 or 5. Down into 3, so you're covering distance, right? Distance with your needle. More needle. I always am trying to find out more stimulation versus just tap it in. You respond with a little tiny spot. But if I thread it along the channel, it increases. Twist the needle, wind it. I call winding it. Wind the needle until it grips. You can't. You just tap it in and boom, they've had a chi explosion. But for some patients, you can needle and they're not getting it, it's just empty. They're not getting anything. So you can I just wind it one direction. To me, it doesn't matter which direction. I go clockwise, but that's just. And then it'll wrap up in the fascia. It'll twist up in the fibers. And then now you've reacted with not just when you're pulled on by that twisted needle and the fibers that have wrapped around it. And this is useful on any point. Why are we doing kidney channel here? So, kidney channel, opposite clock with large intestine. So we're getting large intestine channel, and if we look at the chart here really quick, let's go, there it is, handy dandy chart. I've still got my pointer up here. See if I can grab the pointer. I can. So we've got large intestine channel on the sternocleidomastoid. Let's see if I can get. Here's large intestine channel. Also, a little bit more scaling, some scaling involved there. And the whole thing goes up and under the neck and all large intestine channel. So, how do we treat large intestine channel? Torso image, opposite clock. Neck area, right? So here's a great indication for kidney 3. It treats lymph node swelling. Palpate someone's lymph nodes, you find the tender swollen lymph, a little bit of earache maybe coming down. You can needle that kidney 4 into 3 and it'll drain literally while they're on your table. And the tenderness usually goes. And it's a very channel-driven treatment here. Okay, let's see where. Let me move my. I'm getting some freezing on my images. Let me check some. Okay, Trace. Could it just depends on how much some redundancy, right? Exactly. So I don't think that they cancel each other out at all. Being distal, I don't see that happen. You may not and go, how's your nose? And they say, oh wow, it opened right up. I'm done, right? If they're having the I'll just do those PC points and call it good. I really do like the stomach 3637. I use that because I'm using it for abdominal too, right? Intestinal stuff. So it's kind of getting double. And I think that I want to hit the intestines. So I'm not doing all of them, but pick and choose my favorites. I'm just giving you guys. Okay, great. Opposite side, yes. All these points are opposite side unless it's same channel. So stomach channel treating itself, same. Or paired channel, opposite side. So yes, opposite. Threading direction, not important, but I find my needle, it's very hard to get it down to kidney 4 or 5. If I start at kidney 4 or 5, it's really easy to flat, right, and then fall into the hole at kidney 3, right? I can edge, and oftentimes I'll be a little too sharp on my angle, and I'll hit the edge, I'll back it up, I'll change I'll change my angle a little bit more and then slide right by the edge of that calcaneus. That I really like, just scraping along the edge technique, if you will. Just made that term up, unless someone else is. So a lot of the points for the rest of the conditions are similar. So I spent a bunch of time talking about those points. I'll just be like previously said. Okay. Get it out of the way. Good. So herbal treatment. So Magnolia Clear Sinus is an excellent formula. Love it. Very similar. One of them's heat, one of them's cold. You know, pick your preference on your symptoms. Pills. Pimancon is usually one of my favorites. It just has a really good allergic reaction. So it seems to have an Ibu Shirzao. You know, it reacts with the responding right to the allergicness of the stuff you're breathing in. It also seems to get not only the nose, like BNP, an open nose, but it also gets eyes for those kinds of cases. And then, of course, if they're not in an active infection, I like them to take some kind of or like a cordyceps 3, which is evergreens, or giving an immune boost. Typically with my long-term allergy patients, I'll give them the symptomatic branch treatment. And then in the off season, when they're not having that allergy, the jade windscreen all year, and then when we get to spring and they start having symptoms, I switch them back to the on there. So after a couple of years of that, I find that if they haven't destroyed their digestion with terrible food, that usually they're just really not having to take the formulas anymore. So my goal is to get them off. We can help people, that's what we want. Okay, good. All right, lifestyle and nutrition. So basically, well, so if we can encourage anyone who's having babies or already had babies, we'll talk a little bit about pregnancy later. The more they can breastfeed, the better they can breastfeed. That's just the studies. Avoidance of early allergenic foods. One of those is 3, less saturated fat seems to be useful. Boosting immunity with mushrooms, as does yeast. And the reason why yeast does is you can think of yeast as like a little tiny one-celled mushroom, basically, and blah, blah, blah. But actually, yeast, especially like a nutritional yeast or a brewer's yeast, very nutritious, really over again in research studies. Gregor has a ton of videos about it, but not for Crohn's patients, so no yeast for them. And it seems to be this stuff called beta, and it makes a big bunch of difference. Yeah, any mushrooms, they're all great. Obviously not the poisonous ones, but even the little button mushrooms have a really strong immune boosting function. And it seems better than worrying about whether they're organic or not. If you have the option, of course, go with the cleaner food. Information and let you guys do that. Moving along. Didn't go. Let's click it again. I'm going to get rid of my arrow for a minute, guys. Okay, now it double went, so let's go forward. Okay. All right, that was it. Mold allergy, basically the same thing, and try to get away from the mold. Usually they're living in it, right? And when I left, I was so much better. So you just try to take care of that mold. If Pretty much that's it. Sorry, that's all I got. But I would say that definitely no beta glucan for Crohn's, Cynthia. No, no, no. And no nutritional yeast and no brewer's yeast, which means they should probably avoid brewers, beer yeast. Okay, moving along. Immune system. Let's see. We were supposed to take a break at 11:45, which we aren't there yet. So, yes, Jay, cooked mushrooms. There seems to be a slight toxicity with dogs. So it looks like it's safer if you cook them. Great in stir fries. Our favorite stir fry is leafy green or quarters with a bunch of mushrooms, and season it how you will, and it's probably our favorite meal. Bake your house. Oh, interesting. Let's see. So much information. Yeah, I'm going to keep dumping it on you guys. Okay. Pathology, microbiome deficiency oftentimes is this weak immune system. So it's the microbiome just called the beneficial bacteria that we are symbiotic with in our intestines, right? Microbiome. Always some harmful bacteria there, but you can either eat to wake them up, or you can eat to make them sleep. So the spores of them are always there, but they may just be asleep. And stick something in your mouth. It's your choice whether you feed the good guys. And then what about the stuff that's on your food? Like Montezuma's Revenge, for example. You go to Mexico and there's just a little something toxic in. Look how clean it is. See the drops of water? No, not the water, not the ice, and then you get sick from that, right? So it's a microbiome. Further, smoking, excessive alcohol. Now, excessive is an interesting term with alcohol. Obesity seems to weaken the immune system. I didn't know that till I read that. Lack of fruits and vegetables is a huge driving factor with weakened immune system. Harvard's website, so go look it up there if you'd like. And on we go. Diagnostically, infective particles in the. Of course, the immune zone is the big one. If that one is not tight and tender, it may be totally empty, weak, deficient. Usually, the appendix is full of lymph tissue. So I think of it as an immune prognosticator, which is kind of why the lymph is so tied into the appendix. A little bit more empty than if they've had one removed or something. But the scar could be an issue. Sometimes we might need to adjust scar therapy. Spleen also might be tight, tender, especially the middle spleen. Of course, if the microbiome is uncomfortable, the large intestine, so pulse-wise, we're looking at spleen and lung organs, probably weak, deep, soft. If they're having active immune reactions, there may be some wiriness temporarily and weakness under part of the pulse, and then when you go deep, washes out. Is a good prebiotic. Some of the, I'll talk about rice in a while, about why rice is so great. The classic, give white rice to people who are sick. Good. Oh, immune zone, lower right quadrant. Liver, lower left. I find it lower right quadrant, liver like liver crossing, right? So the liver itself is a zone, and then a side is the immune. That's for me anyway. There are different systems, of course. Okay, treatment-wise, sleep more. Here's meds. De-stressing, you know, finding ways to deal with your stress that isn't, you know, strangling your family. Having a good COVID party. Eating more fruit and vegetable, et cetera, et cetera. So here is our little image. We're going to be looking for what images we want, right? What zones? So we've got stomach channel running down the side. So that's our large intestine zone is right here at stomach 12. We've got spleen on the outer line there. So maybe, I think for me, the intestine, the large intestine, is kind of half split between spleen and stomach. So I think that, you know, part of that large intestine, ascending and descending colon, are spleen channel. Part of it is stomach channel, and then of course, internal organ, of course, large intestine channel. And then as you go, the descending colon, same thing. As you get to the sigmoid colon, now you've entered this sort of liver crossing zone. So that's the area to pay attention to. So you might use the liver crossing as you get to the sigmoid colon. Now you've entered this sort of spleen 5 area on that same side, which would be the left, to treat that lower left quadrant. Of course, small intestine is in the middle, so kidney channel is a little bit involved there. But of course, I find that to be a spleen zone, so I'm using spleen 9 to treat that. That's probably internal channel of spleen going into the small intestine there. And that's usually most of where we're dealing with for this abdominal palpation, and then channels that we want. Let's get rid of our pointer again, and off we go. Okay, let's see. So channels, digestion, lungs, Wei Qi, immune, right? That's kind of our classic TCM version of immune is the Wei Qi. And Wei Qi we're going to find lungs, but not necessarily in the lungs, right? It's sort of like our force field-ish, the Wei Qi that's produced by, and how do we tonify Wei Qi? With herbs. We give herbs for what? Digestion. We give Huang Qi. It's a spleen herb that tonifies the immune system. Chinese have been doing it for thousands of years, right? So this immune digestive, you know, component is tied into our medicine. It's perfect. We're perfect for it. And so we're treating spleen channel, stomach channel, maybe lung channel a little bit, or lung points at least, to drive maybe some of that circulation into the lung system where we can get more of an immune reaction, possibly. Kidney points, because of the kidney channel, right? Kidney channel, so kidney points are, you know, large intestine points, opposite clock with kidney. Also to treat themselves, large intestine. And then CV in the middle, maybe treat with GV, possibly. So here's the points, stomach 36, 42, same kind of reason, navel, middle jowl, right? And then we've got spleen 6, 7, and 9. I really like spleen channel treating its own channel. It also treats paired with stomach. Someone was asking internal, external relationships, internal organ relationships. I don't think that harms us in any way with these TCM characteristics. And of course, it just adds to yet one more reason, right, to pick the points. Kidney 3, 4, same kind of reason for that immune, you know, related to the lymph specifically here, but you could make the case that it's going to treat lymph maybe anywhere. And then liver 3, LF 4, I just like general sort of, I like 4 gates a lot. So, you know, general circulation, blood, Qi everywhere. Li10, of course, is needed to treat that opposite. That's a specifically left-sided Li10 points to treat triple intestine 10, if you will, to treat that immune zone on the lower right. And then lung 7 and 9, treating its own organ. And source point, you know, so classic TCM reasons there. PC6, you know, kind of opening up the chest. Also, it gets the lower abdominal area. And then triple warmer 5, same reason. So let's look at PC6 triple warmer 5 really quick. So if we've got head, neck, right, upper torso, so we've got PC6 kind of right in the middle of the chest area. Same reason, triple warmer 5 in the middle of the chest area. Pericardium is treating opposite clock stomach channel, so it's really good at opening chest right down, treating breast pain, breast issues, chest issues, lung issues, heart issues, anything that those channels go 3D. They're three-dimensional. They penetrate right through. So that stomach channel going right through there treats all that. pericardium channel, opposite clot. Triple warmer treats the spleen, and if we go back and look at our chart really quick, spleen channel kind of goes up, and then I have it stop right there at the rib cage. Actually, what I think really happens is it dives inside the rib cage, right? Here's our skeleton, goes inside the rib cage and runs along the inner area. So there's a muscle called serratus internus on the inside of the ribs. So if somebody's having a rib issue and you're not quite getting it with all the external channel points, try triple warmer opposite clock for spleen and get the level right, and you might just get the rib from the inside if it's internal. Also, I think it's the pleura, possibly, around the lungs, right? So that kind of makes sense too, where spleen dealing with its fluid metabolism and transforming and transmitting fluids, you might find that that fluid is sacked and filled around the lungs, kind of putting pressure on the lungs. And then when you want to treat that, triple warmer points, because the spleen runs up and around the lungs maybe, okay? So I like that very much. 10 times 2, that means 2 needles at 10. So Li10 times 2 needles. So 2 needles at that area. It's just my shorthand abbreviation of what the X means. So you'll see that come up a number of times. Oh no, it would be only left side. Bilateral, I would put bilateral, or I just don't mention what side, and then that means it would be bilateral. But in this case, it's opposite side Li10 times 2 needles. So maybe 2 needles in that small area, giving you sort of that, if you're familiar with Master Tung, the Dao Ma technique, which means you're doing multiple needles in the same area, giving you an extra influence on that channel. Yeah. Thank you for chiming in, though. Please continue to give each other answers. I'll try to catch up with those as I need to. Great. So that was why PC and triple warmer channels. Location-wise, we talked about chest area, but in this immune one, I'm actually trying to deal more with the abdominal. So here we go with our reversed image. If we do the image of, head, right, neck, upper torso, right, navel level at the elbow, so therefore large intestine 10, again, navel level. But as you go down the abdominal area, right, here is the bottom of the pelvis, so that means PC6 and triple warmer 5 level are now lower abdomen. So now we can get small intestine, we can get ileocecal valve, we can get the lower part of the sigmoid colon, we can get some of the large intestine and small intestine on that lower abdominal area. So not only do those points get the upper chest, they also get the lower abdomen. So triple warmer 5 PC6 getting lower abdominal areas as well. Very useful in treating anything digestive or chest related. I like them both. Naguan, internal, external gates. Herb-wise, we're doing Immune Plus. That's the formula I was trying to remember. So that's their basically Yuping Fengsan with Evergreen. Excellent. It's just those same. Basically, it's Yuping Fengsan with cordyceps in it. And then cordyceps 3 again is very similar. Cordyceps, astragalus. It's just your basic tonic formula. Those are very useful for weak immune systems. I give cordyceps a lot. I oftentimes will either use this formula or I will buy cordyceps. We'll talk about it a little later from a company called Aloha Medicinal Mushrooms, and I just buy it in like a kilo, and it's an excellent price. The guy is a mushroom genius, and he even has a super cordyceps where he's hybridized various strains. And he grows them all in laboratory settings and then grinds them all up. The cost is absolutely the same as granules. So I just throw those bulk cordyceps right in my granule formulas, and I find really good results with that for the patients who need it for either adrenal or for immune boosting or any kind of brain disorder. I like cordyceps too. I think it does that blood-brain barrier thing. And of course, Yuping Fengsan are classic. Excellent. On we go, guys. Go a few more minutes, maybe finish up immune and take another quick little break. Immune function declines with age. So if you didn't know, as you get older, it gets a little worse. So we have to be a little careful as we age and with our elders, which is another reason why they may be having issues more so with the COVID era that we're in this year. So for posterity's sake, as people watch this video in years to come, this is the COVID 2020 we're in, everybody. And hope everybody's having a good pandemic. It's been wonderful. Intestinal lining is 2,000 square feet. Wow, that's huge. And it is thinner than tissue paper. So you could see that if you tended to eat food that damaged the lining, there's not a whole lot of lining there to damage. I mean, it's not real thick. It doesn't have a whole lot of barrier. So if you were to damage the intestinal lining, you could see how the bloodstream being right there behind it would start reacting. The immune system would start reacting with particles of food or particles of animals that mimic our similar tissue, right? The cartilage of a cow isn't going to be a whole lot different than the cartilage of a human. So if you're eating cow cartilage and you have a leaky gut and it penetrates through the wall, some of that cartilage protein, do you think our immune system is going to react? Is it going to react with that cartilage and then react with our cartilage? It's a likely case, and there is evidence to that, actually. So cruciferous vegetables seem to heal this lining very nicely. Cruciferous meaning the vegetables that have a flower that is in the shape of a cross. So that's why cruce, right? It's a four-petaled little white flower, and that would be your kale, your broccoli, your cauliflower, you know, all the cabbage family. Most of the Chinese leafy vegetables like bok choy, napa cabbage, they're all going to be cruciferous. So very beneficial stuff. There's a stuff called sulforaphane that's in cruciferous vegetables, and when you chop it or blend it when it's raw, these two chemicals react with each other and create this like super nutritious immune boosting chemical that then when you heat it doesn't destroy it. So chop those things up, let them sit for a few minutes before you stir fry them, and you get a bigger boost in immune function, like a superfood immune. And then the lymphocytes are triggered, and it repairs that lining. So that's sort of, for more information on that, see Dr. Greger's book about it. It's in his How Not to Die book, and I put the page numbers on there. So go read to your heart's content. Fascinating stuff. And berries are natural, boost the natural killer cells. So that's kind of neat. Viruses, cancers, berries are incredibly beneficial that way. So don't forget the berries. Basically, if it's from a plant, you're probably pretty good off. Cesarean babies are at higher risk for allergic diseases. This seems to be because here's where the probiotics are a big piece. As baby goes through mother's vaginal canal, about a week to 2 weeks, maybe a little bit further, somebody who knows more than I do chime in, it seems to be that mom's vaginal canal becomes flourished with lactobacillus acidophilus. And so as baby goes through, it just gets covered with lactobacillus acidophilus. It goes in the mouth, and the nose, and the ears, and the eyes, down the throat. The first breath, the first swallow is just full of bacteria. So it just coats the intestinal lining with lactobacillus to start out with. And then as soon as baby starts breastfeeding, they get bifidus. So those are the two really important ones, is lactobacillus acidophilus and bifidus. And so whatever probiotic you guys are going to want to use, just make sure it's heavy, heavy, heavy on the lactobacillus acidophilus and bifidus. And those are really the only two strains I give tremendous amounts of, talking about hundreds of billions to my patients who have intestinal issues or immune issues, especially if they've taken antibiotics in any recent history. Probiotics increase the white blood cell activities. Prebiotics are feeding the probiotics, right? So that's basically fiber, which only comes from plants, no fiber in animals, and feed the good bugs, right? And so certain foods tend to have more of that fiber than others. Mushrooms have a bunch of fiber. Beans are loaded with fiber. And some foods like rice, potatoes, and another starchy vegetable will actually form what's called resistant starch 3 as it cools after you cook it. So fascinating, the leftover rice is actually healthier than the fresh rice, which is amazing. But and at temperature, so you take that rice you just cooked, you put it in the fridge, and it starts forming these resistant starch bonds. And that takes, they've done studies, at 1 hour it's more, at 5 hours it's more, at about 12 hours it's like off the chart. And I think they stopped the study at 12 hours. I don't know why, but it seems like the longer you leave it, maybe the better it gets. But when you do eat those, then it's like super food, super prebiotic for our good bugs. So don't knock the white rice porridge that kind of sits and starts. Oh, corn was the other one. So it's white rice, corn, and potatoes all form this resistant starch. Probably there are other fibers that do the same thing, but those starches for sure do it. So very, very good for our intestinal flora and benefit. If somebody's having intestinal issues, put them on a little white rice porridge, and we see magic happen. Been doing it for thousands of years in Chinese medicine, and lo and behold, there's scientific evidence for it with the resistant starch. How about that? IgA gets boosted with the mushrooms. It's also anti-inflammatory. So not only does it boost the IgA, it decreases inflammation at the same time. Very useful. Candida specifically, there was a number of studies done, and the ones that Gregor had looked up, he had said that actually the evidence that there's a condition of Candida didn't exist. When they put people on double-blind placebos and they went in both ways on the yeast, the ones that got the placebo thought they had symptoms. The one that got the non-placebo thought they didn't have symptoms. It was all over the place. So there wasn't really, it didn't come out as being evidence of a condition. And research that it actually doesn't exist. So that's interesting. Go watch that and chime in your comments on those videos. Okay, upper respiratory infections. Let's see if we got life space. Don't know what life space is, sorry. Brown rice. Yes, it does. It looks like all the rices, black, brown, red, do that. Prebiotic. White was the one that was studied, to my understanding. So that's what I would go with. But usually what we do is mix our rice these days. So I'll do brown and white. White tends to be less harmful with arsenic. It seems to be that rice tends to be a plant that as it's sucking up water when it grows, it sucks up arsenic, which is a bummer. So, and the arsenic levels are toxic if you eat a lot of it. So like if you're eating white rice every day and you use rice milk and you eat rice porridge, and if you're eating it 3 times a day in various forms, you can get levels of arsenic that are starting to have symptoms. So some areas of the world have more arsenic than others. The southern United States actually is loaded because it was in the pesticides that they used on the cotton plantations. So I wouldn't be getting Uncle Ben's rice from Alabama, bad stuff, loaded with arsenic. Whereas the California growth area is safer. Japanese is a little safer. It looks like Thai rice isn't so bad, Korean. So there's some brands that seem to be a little bit more than others. So, okay. Good stuff, guys. Reheat the rice. Yeah, if you reheat it, it doesn't seem to damage that resistant starch bond. So, yeah, cool it off, let it do its gel thing in the fridge, and then take it out, throw it in the microwave, heat it up how you will, and no problem. The resistant starch is still, right there. Not hurt if you heat it, or potatoes. I don't know if bulgur does it. Sorry, Amber. I just know about those 3. They were wondering why there were less. The reason they know about the corn is there are areas of Africa where they don't eat a lot of fiber, but they eat a lot of corn, and they weren't having intestinal problems. And they know that cultures that don't eat fiber have intestinal problems, and they were trying to figure out why. And it turns out corn makes the resistant starch. Even when you they would do cornmeal and they make some kind of a paste with it. And even there, it's already making resistant starch before they cool it off. So that seems to be what was creating butyric acid that was helping their intestines and not creating a lot of intestinal disease in that particular village area. All right, moving right along, guys. Let's do a quick break before we go into upper respiratory infections, which is good old coronavirus. Let's just pound that one out and see you guys in 5 minutes, okay? So let's say 11:55 on my clock. Would that be all right, everybody?
Hey, Cole, can I give you a call at the break?
Yes, reheating was okay. Doesn't harm the resistant starch.
Also, Donna said that when we come back up, she will do a little intro, and then
Okay.
we'll go from there. Okay.
Great.
I'm freezing up here.
There you go.
Hey, Sam.
Hi, guys. Welcome back from the break. Before we get started here, I'm going to do a quick little chat with you guys. So, I'm out of curiosity, why did you guys become an acupuncturist? Type it into the chat room. I'm looking at it right now so I can see your responses. For me, I wanted to do something that was related to my culture because I grew up in a predominantly Hispanic area. So there wasn't a lot of other Chinese kids that I could relate to. And it was just like an awkward growing up. And I wanted to find out like a self identity, who I am, what my culture is. And growing up, like any Asian mom, my mom was always like, okay, make sure you dry your hair after you shower. Don't go out. Well, she said this, don't go out at night because the ghosts come out. So I don't know if she's just not wanting me to go out or not. But a lot of the sayings in Chinese medicine, they are they are actually legit. So she wasn't wrong on a lot of them. Maybe the ghost part though. I'm not sure. Couldn't find much answers in Western medicine. I've noticed a lot of that actually as the longer that I'm an acupuncturist, why that there are some holes. I wouldn't say a lot, but I have noticed some holes in Western medicine that Chinese medicine covers. I'm not saying that we should do away with Western medicine. It's really great for emergency, but for things like migraines, I think it maybe some people are taking advantage of over the counter drugs when they don't need to. And Nancy said she was a student of Sifu Augustine Fong, and he taught that if you're going to learn to fight, then you should learn to heal. That's beautiful. Awesome. Well, I want to thank you so much for sharing all that with me. And so I wanted to know what, if you guys, what challenges that you might be facing in your practice now, especially since COVID hit? Do you have extra time to improve your clinical skills? Do you want to learn herbs so that you can treat more remote medicine? I know for myself, I'm in that awkward stage where I'm like, oh, should I still do treatments? My status right now is that I'm not. And oddly enough, yesterday, two people texted me and asked me about acupuncture. One was for anxiety and stress, and the other one has had migraines, really bad migraines for a week. And I've been trying, and then another person, actually, so it's three, and another person, mom had Bell's palsy. And I'm trying to help these people and get referrals, but everyone I know in the area is also not practicing. So it's really hard. And these people want acupuncture, and I want to, but I want to be safe. So it's really, ah, I don't know. For me, it's just I don't really know what to do. I want to help them, but I also don't have the resources to at this time. So it can be conflicting, and luckily they are open to taking herbs and going with the referral that I send them to for remote medicine. So if you can solve the challenge for remote telemedicine, what could that mean for you? And also, what could that mean in additional revenue? I'm going to take a look really quick at the chat room here. I see some responses. You're welcome. There are two essential parts in having successful practice. We have the hard skills and we have the soft skills. The hard skills include your treatment skills, your herb knowledge, your diagnostic skills, your acupuncture skills, tuina, and this can take years to refine if you're figuring it out on your own. Plus, you'll also need the patient load in order to validate your treatment efficacy. So the soft skills, so what's that? This is your PR skills, your people skills, bedside manners, your sales skill, your marketing and talking with patients, making them comfortable, how to retain patients, knowing when to ask them to come back for another visit or interest them in a care package if you have one. So the bottom line is that you have to invest in yourself to build towards your ideal practice. Do you agree with me? Yes. So today you are exactly where you are supposed to be. You'll be learning from one of the most skilled acupuncturists in our profession. Cole has dedicated over 20 years using his body mapping acupuncture to help his patients, learning what works, what doesn't work, and today he's sharing his best tips with you. He's going to save you 15 plus years. He knows every mirror and imaging of the body, and the man loves his research. So everything that he shares with you, it's backed by science. He's here today to carry on his legacy and to be able to help more people in the world by sharing what he knows with you. We are a team, all of us together, so that we can help more people. So classes like Cole's, in which you can learn from experts in a short amount of time, is exactly what you want. I know it's exactly what I want. I just have a short attention span anyways, and I just want the meat and potatoes. I've done my schooling. This is the much faster road to success than learning everything on your own with no help, right? Yes. So, how many of you are interested in improving your hard skills? And this is the refining your acupuncture technique, learning how to prescribe herbs, or improving your diagnostic skills. Yes, me too. And how many of you are interested in improving your soft skills? This is mostly your social skills, which includes bedside manners, marketing, and PR. I know. I would love work on that too. That one's a little harder, in my opinion. And how many of you would be interested in joining a collective in which you only learn from verified experts in our field? The best instructors to teach Master Tung, the balance method, pulse diagnosis, auricular diagnosis, herbal medicine, functional medicine, herb drug interactions, Japanese acupuncture, abdominal acupuncture, Korean hand acupuncture, practice management, etc. There's so much. And then on top of that, how many would be interested in getting additional support from TCM vendors like acupuncture supply companies and herb companies? They would give you resources to help your practice thrive. And so if you said yes to either questions, what do you think about having a membership where you can access 3,000 CE hours from and learn from over 200 experts in our field? And this is why I want to introduce you to the path of your dream practice, which is our Gold Path membership. It's an annual membership to our eLotus online platform where you can learn from all that I mentioned above. The regular price is $1,500, and today we are running a special for $999. With COVID going on, this special has been put on hold, but it's finally back. Our reality is not 100% back, but the Gold Pass membership is for now. For those of you who feel it's a good time to invest in yourself and be closer to the practice of your dreams, our sponsor at Helio will offer you 10% off of your needle supplies, and our other sponsor, Evergreen Herbs, will match your tuition or the cost of the Gold Pass with a collection voucher of $999. I'll put the link for you up to read more on it before you decide. And I've also sent you an email so you can look at that. But the price is good for this weekend only. Also, if there are any Gold Pass members today, please feel free to share your thoughts on it in the chat room with your colleagues. Was it worth the investment, and how has it transformed your practice? And if you guys have any questions, please feel free to email me, info@elotus.org, or private chat me in the chat room, because I'm going to go ahead and give the stage back to Cole. Okay, thank you so much.
Are we back on? Can you guys hear me? Hello, hello, testing. Yes, you can hear me. Okay, we're back on the mic, I think. Good. Hopefully this freezes less. We restarted, we rebooted, we revaccinated, you know, all that good stuff. Okay. New cup of tea. All right. Probiotic brand, I saw somebody ask. I like Genestra from Sir Royal is where I buy it. And they have a human strain. I mean, the guy, Dr. Plummer, who is the researcher for the last, I don't know, 30 years, I just like what they're saying, you know. I mean, I'm sure there's a lot of great brands out there. I think I have patients who take their own that they like. That's fine. But and it seems okay. Other brands seem effective. But the Genestra Sir Royal specifically, I mean, it's they cultured human strains, and their research shows that they stay in the intestines for 6 months after they stop taking them. So it's not like you take it for this meal and you're good for that meal. You take it for this meal and it still has effects for months. And they've got so many versions. There's an immune version, there's a kids version, there's chewable, there's powders. They've got a 500 billion, that's a 30-day supply of 500 billion a day, little packets, and it's $125 for the patient. I mean, I think that's out of sight good price. I mean, that's a half a trillion. And you really actually kind of need that much. We talked about that in the last seminar quite a bit because the amount of bacteria living in our intestinal system changes as you go down the intestines. Like in our mouth and on our skin, it's in the millions, maybe a billion. In our throat and our esophagus, it's in the tens of millions. In the stomach, it's tens to 100 million or so, maybe a billion. As you get into the intestines, the small intestine, now you're into the billions, right? 10 billion, 50 billion. But when you hit the large intestine, it's literally trillions. So unless you're giving huge amounts, we're talking hundreds of billions of bacteria a day, I don't think it's touching the large intestine personally. So yeah, Soroil. I keep them cold. They say they're good for 30 days at 90 degrees. If I buy it from, another wholesaler, maybe they were in Arizona. It sat in a warehouse at 90 degrees. I don't know. So I get them directly from the factory, I guess, Soroil, and they ship them from Canada. They come straight to me in cold packs. I put them in my fridge and I give them to a patient at day one. I mean, I know that they are good. If they go to the grocery store and buy it from the grocery store, I don't know where that's been. They don't know where that's, So I just think that a lot of patients feel safer, if it comes from you guys. And if there's other brands you like, I'm not, I don't know the studies on other things, but a little bit warmer than 90 in Arizona, yeah? I was thinking winter temperature, but yeah, okay. Yeah, you're welcome. I like it. I've seen it do great things. And usually people who've had, many rounds of terrible antibiotics and their guts are wasted, 1 month of the 500 billion seems enough. And then as long as they've changed their diet and they've eaten the appropriate fibers, boosting their prebiotic and their fiber content, their gut changes around, 116, changes around pretty quick. And then I think they say the maintenance dose is about 25 billion a day. So yeah, 25 billion a day for people who have symptoms. I think that for people who don't have symptoms, there's a couple of doctors that I like to listen to, and they say 10 billion for everybody forever, just because there's antibiotics in our water supplies now, through overuse in farm lots, etc. Okay. Yeah, they have a lot. I know. I like just the basic one. It's 2 strains of Acidophilus, 2 strains of Bifidus in their super 500. It's the 500 billion a day. They've got also another super that's like a jar. That's, I think it's a scooper, so you can scoop out as much as you want. The capsules, 10 billion capsules. They've got a 50 billion capsule. They got a 20 billion capsule like that. So you can just kind of pick the ones you use. I use the 500 billion a lot on the ones who are the worst, like Crohn's type patients, really bad guts, temporarily. And I use the intensive care, which is I think 30 billion a capsule. That's a 30-day supply in little pills, so they can just swallow a pill. The super powder I've used quite a bit. And then the chewable, I give the chewable to my kids and they just chew them up, and that's great. So yeah, that's on Soroil's website. Okay, on we go, guys. We got to get through immune. We got a bunch of stuff to do in the next hour, so we're gonna light speed. Upper respiratory infections. So here we are with URIs, colds, virals, rhinoviruses, coronaviruses. Not unfamiliar to the common nose, but not, of course, the novel version that we're having trouble with now. Symptoms: rhinitis, pharyngitis, cough, fatigue, malaise, fever, etc. Risk factors: direct contact. We've heard all about these risk factors lately, haven't we? Direct contact, homes, schools, touch, eyes, and nose. Schools, yeah, well, we're homeschooling. How about you guys? Having fun with that? Can't wait for fall. Another fun-filled year, everybody. Allopathic, hard to distinguish between flus and colds unless they're doing lots of very specific testing, which usually is unnecessary. Severe cough. If somebody's having severe cough, they're usually trying to rule out pertussis. So they would do that. Abdominal palpation, immune is the spot usually going to show up here. Pulse, again, same like before, large intestine, stomach pulses, channels, floating, superficial, windy type pulse. Cover mouth and nose when coughing and sneezing. They're going to tell you wash your hands, maybe wear a mask. That's the new one. Moderation exercise. Looks like endurance athletes that are doing heavy duty exercise are more prone, right? It looks like their immune systems have to get into the healing of the overuse, right? So the moderate exercise is immune boosting. Excessive exercise is immune suppressing. I didn't really know that till I saw the studies. Fascinating. And symptomatic treatment. So they're just going to treat what comes up. And of course, there's all the types of various drugs, antibiotics, et cetera, et cetera, et cetera. Obviously, antibiotics for viruses is kind of silly. You'd have to use an antiviral, but how many patients have you seen on antibiotics for a virus? Seems kind of crazy, but it happens. Can build immune resistance by giving antibiotics and using all the antibiotic gels. We weren't using any of those stuff until recently in our office because I just didn't want to create super bugs around here. But it looks like we're going to have more super bugs coming down the pike. Okay, so all the same places in the nose. We've got a little bit of lungs to think about now. There might be a cough. There might be flu, achiness. So we might have channels in the back to think about. Small intestine channel, bladder channel, that kind of thing. We'll continue on there. Large intestine, stomach, bladder, gallbladder, small intestine. And in this case, the pulse of small intestine, if they're having achiness in this upper back area, either whether it's bladder or small intestine channel, that small intestine channel pulse will be wiry on the surface. Really common. You take that left hand, Tsun position, very superficial pulse. It will just be like a wiry little twangy thing on that superficial small intestine pulse, and they definitely have some kind of upper back tension or tightness or pain. Usually they feel it, but sometimes it's just tight. Great, on we go. Points, your basic points, LI, triple warmer, pericardium, talked about all those. I do like the wind aspects of even triple warmer. I do like, if I have a patient who comes in with that windy kind of pulse, I will LI4, triple warmer, I love them. I think they can just blow that wind out. It's nice. I just, don't throw out your TCM stuff. And then we've got specific things. So if it's nose and sinus, then there's your sinus points. We talked about those already. If it's cough, so now we'll talk about these zones. So the leg as the whole body. Here's head, right? Neck as the ankle, upper torso, being this lower leg. So there's our upper torso, stomach channel, chest, right? Here's neck, upper torso. So like mid chest is going to be like right there. Stomach 40, anyone? 38 to 40 area. I always put a zone because you might want more than one point. You might want to cover an area of chest, maybe the entire lung possibly. Spleen 9, same reason. Kidney 7, 6, same reason. This area of kidney channel 7, it should be 7 to 8. Yeah, 7 to 8. I misread that. 7 to 8 is in this zone, same chest level. Kidney treats its own channel. Very nice, right there in the middle area for the lung as it attaches. I don't find I need kidney channel much unless it's rib issues. If it's just the lungs, I don't find the lungs really going all the way to the middle. They kind of stay out, stomach channel and then PC channel. So pericardium treats itself, stomach treats pericardium. So stomach 40 not only gets stomach channel same side, it gets pericardium channel opposite side because they're opposite clock each other. That's nice. And then of course the PC6 gets its pericardium channel same side, again good for breast pain too, and opposite clock stomach channel. So you get both. Lung points treating itself, and LI6 we talked about already. Headaches we talked about, eye level headache. So gallbladder channel, eye level headache, opposite clock heart, opposite clock bladder lung. That's the lung 5. If it's stomach, you've got the large intestine 4, spleen 9 for the triple warmer zone. So that's all the headache points. And if you want the big guns, heart 8, lung 10, and you can do PC 8 also for that stomach zone. Pretty uncommon. It's rare to see stomach channel headaches. At least, in fact, the original versions of my charts, I didn't even have stomach 8 on there excuse me, because I hadn't seen it in the first 10,000, 15,000 patients. So I figured I'm only putting on here what shows up, and it hadn't showed up. With heart 3, lung 5, I had always cleared headaches in the front until I finally had one that it wouldn't clear it. And so I did PC3, and then it got it. And I thought, okay, stomach channel on the forehead, it does go there. It's just really rare. And then throat, we talked about throat. So large intestine, we talked about PC6 and 7 for throat. We talked about stomach 41, same channel. Spleen 5 is just under to stomach 41. Spleen gets lung. There might be a bit of a lung up to the voice box, the windpipe, right, as the lungs go all the way up. And then LI5, throat. It even looks kind of like a throat. Can you see my anatomical snuff box? So it looks like a throat. There's a couple of little tendons, and you can thread LI5 right in there. I love this point for throat problems. It's probably my favorite throat point. That one, PC7. I love PC7 too. I'll do them before I do LI1, before I do lung 10. I'll do these two. I just love them. They nail it. Yep. Okay. Moving right along. Lots of herbal options. Resveratrol, they've got a series of resveratrols. You can do cold, you can do heat, you can do deficiency. You can do Lana-Sera complex. So that's your basic yin chow, right? Herbal ENT. Oh, I really like that formula. I use that for any kind of infection anywhere. I use a guiding formula for the area, and then herbal ENT goes in there. It's full of like all these indigenous Taiwanese herbs that just kill it. I love it. That's probably my favorite one of their formulas. If you didn't have that, or you weren't available to get it, and you can get a hold of Chuan Xin Lian, Chuan Xin Lian Tong is another one of my favorites that I would use for infection anywhere. So, yep. Yep. Yuping Funk's on a course when they're not in the infection, when we're tonifying. Occasionally, I'll come across a case where somebody is having chronic infections, right? So their immune system is too weak to fight it off anymore. So we have to tonify, but you can't tonify too much because you'll tonify the infection. So we have to balance, right? We give them the tonic formula and we give them Chuan Xin Lian or herbal ENT at the same time. Then the patient can vary the dose themselves. So if they're feeling really good, I have them take more of the tonic. If they're feeling more sick, I have them take more of the heat clearing, toxin clearing, viral killing combo. But they're always taking a little bit of the other one. So even if they feel really good, I'm having them do like a quarter dose of the killer. Or if they're feeling really terrible, I have them do like a couple grams, just a quarter dose of the tonic, Yuping Fengsan or Immune Plus, right, if you will. Gonmao of course, is one of my favorites for that early wind stage. As soon as it goes hot or cold or achy, done. Gonmao out. You're catching the sneeze, you're catching the scratchy throat. Even if you just palpate their lymph, I've talked my patients into palpating their lymph nodes regularly. And if they palpate their lymph and find some swelling, Gonmao. They just hit it with Gonmao right away. And then a couple days, gone. It never even turns into that. You can take it prophylactically before getting on a plane. It's useful for that. Yin Chow, same kind of thing as the Lana-Sera complex. And then Banlan Gun Tea. In fact, this one has saved me. I used to get terrible sore throats, recurrent every spring. I would get the worst sore throat. I couldn't swallow, terrible. Banlan Gun Tea, I love this stuff. So I don't know if you guys have seen this before. Beverage of Banlan Gun. I don't like that they put a ton of sugar in it, but it is really easy to take. You can hear it rattling. It's just granules in little packets. You tear it open, you dump it in water, and you drink it. Super easy. Fantastic. If I'm starting to catch a throat, I just drink this, a couple cups of this a day. 2 days, it's gone. I don't even get the sore throat anymore. And I was getting them yearly. I was going in for huge bulk formulas. This saved me, guys. I love this stuff. All right. And it's cheap. Easy to give your patients. Yep. Okay. Oh, they have it sweetened with stevia? Oh, you just sweeten it yourself. You mean just get the granule by itself? And yeah, I saw the sugar-free stuff. It's got glucose in it. Is that really sugar-free? Isn't glucose sugar? I don't know. It tasted weird too. Got it. Okay. Keep going. Lifestyle nutrition, basically the cause is an invading microorganism, right? So something's like EPI, external pathogenic influence, and the terroir, right? The territory has to be at such a point that the infection can take hold. Because if your immune system is strong and robust, you just fight off the thing, right? So the question, the age-old question, is it the microorganism or is it the immune system, right? Which one is it? Like, which one's the important part? Well, obviously, less infection is good, so we will wipe our hands and but at the same time, we're going to make our immune system strong, right? So we're going to do both. We're going to try to not be as exposed, yeah, and we're going to improve our immunity. How do we improve immunity? Well, let me tell you, diet can modulate immunity. Did you know? High-fat diets are immunosuppressive. If you didn't know, oh, there's a bunch of research. High micronutrient diets, micronutrients found in mostly green leafy vegetables, fruits, plants, berries, high micronutrient content is very beneficial. Zinc lozenges are useful. And zinc is great. Another one for the throat. That was the other one I would use a lot. I would just suck on a zinc lozenge. I think the zinc going right into it, it's like kills it on the way down. It doesn't even have to go systemic. It like gets right to it and would just like empty my lymph. It was zinc works good. I like the lozenges, especially if they're sambuca and zinc. So that's the elderberry zinc. The elderberry shows signs of being antiviral. So in addition to Banlangun tea or a Chuan Xin Lian or one of those antiviral formulas, you've also got zinc and you've got elderberry. So we can just pile on the antiviral stuff. Vitamin C seems useful for patients with significant environmental or physical stress specifically. So if people are under a ton of stress environmentally, say toxins or heavy metals or just in their environment or like physical stress or even like emotional stress, the vitamin C shows good results in those studies. But with people who are generally healthy, it didn't seem to do much, which I was confused at actually. But vitamin E seems a little bit protective, but the zinc did show. Echinacea studies seem to be inconclusive, which I was also kind of surprised at. Excessive alcohol intake increases, again, we'll talk about what does excessive mean, increases risk. Moderate use doesn't seem to change it. So what is that moderate to excessive? So moderate being 1, 2, maybe 3. Once you get past 3 drinks, whether it's wine, liquor, whatever, then you start having toxic effects from the alcohol, liver having to process so much, and then now you weaken your immune system. But the 1 or 2 drinks, especially a hot toddy, you ever had one of those? Oh man, they're good when you're having a cold, especially the achiness, they just hit it. Useful. That 1 drink, maybe 2 drinks, excellent usage. Probiotics can prevent, really good studies on probiotics that they prevent colds over time. So they took kids that were getting regular colds, they put them on probiotics. One group, they gave another group no probiotics. It was all in pills, so placebo-controlled, no hanky-panky. And lo and behold, cut the colds in half. Excellent. Good stuff. Gargling is useful. Who knew? Parents told me to gargle. I was like, yeah, you're gargling nasty. Right? But turns out there are areas of Japan, I guess that's what the report was, where they're promoting gargling and they get less colds. And when they did the study on it, lo and behold, it worked great. Here's nutritional yeast again. Just a dusting, maybe all you need. Literally a pinch, a little sprinkle a day, an 1/8, a 16th of a teaspoon, tiny amounts to prevent common childhood infections for kids. We put it on popcorn. It's delicious. Kind of got a cheesy Parmesan-y flavor. Kiwi fruit can be useful. 50% reduction in colds and flus, less symptoms. Now, this particular study was done by the Kiwi Growers Association. So take it with a grain of salt, but kiwis are good for us anyway. So don't seem like that's a problem. A couple kiwis a day look like the amount that was useful. Best fruit for the common cold. Here's gargling. Pinch of salt in a glass of warm water. Take a deep breath. Tilt the head back. Drop the mouthful of salt water in and blow out as it comes out. Then you spit the water out. And then you keep doing that over and over until you finish your glass. Pretty easy. Very simple. Green tea might work even better. They did the gargling with green tea, and the green tea seems so beneficial. Antiviral properties. You can make a green tea paste and kill warts with it. Like there's been genital wart studies where they put green tea paste on it, gone. Amazing. So green tea paste, and you can make it yourself. Just buy some matcha and mix it up with some coconut oil, and slather it on. Okay, here's nutritional yeast. Just a dusting. Beta glucan, again, is the stuff that's in the nutritional yeast in the fungus. Brewers are nutritional, same thing. Immune cells concentrated in the intestinal walls. Kids average 6 to 10 colds a year. And you can just drink the green tea. Sorry, I forgot to mention that. After you're done gargling the green tea, go ahead and swallow. Sorry, I skip when I catch something that somebody asked. I think the Golden Kiwi was the company that did the study. We're at maybe Golden Kiwis are especially effective compared to the green ones. Actually, Anne, it only provides B12 if it has been fortified with B12. So most nutritional yeast does not actually have it in there, which is something that vegans need to be a little careful with. So some it's fortified and it's in there, others it's not. So you still might need a B12 pill on occasion for the vegan. And look at some of them have it. So I think Bob's Red Mill has it. There's another brand out there, Red Star or something that maybe doesn't. So look at the brand. Okay, 6 to 10 colds a year, cut 50% by a 16th of a teaspoon. It's like a sprinkle. And there's a nice little recipe, nutty parm. They took some almonds, Brazil nuts, nutritional yeast, blend them all together with a little savory spice, and refrigerate it because the nuts will start to go rancid. But, shake, shake, shake on your favorite. What do you want to use Parmesan for? One of Dr. Greger's recipe out of his book. He has a cookbook too in his How Not to Die series. Okay, flu. Anybody more questions on the good old Corona? Nothing specific for it, just the regular. Good for the gums, yes. Kiwi high in C, yes. Guava. We love guavas. Okay, on we go. Etiology and pathology for flu. A and B, acute respiratory infections, similar to common colds, but more severe, basically. The aches are kind of the thing, the high fever, the aches, lasting longer typically. And 1 to 4 day incubation, this is the worry on the flu, is that you can have it for a couple, 4 days and not even know, spreading it all over the place. Infectious for 24 hours before you even get the symptoms, and that's another question on the corona. How long is that thing infectious before you even feel anything, if you feel anything, right? 7 days after initial symptoms, so you can still be infectious with flu for longer. H5N1's the classic bird flu, 100% fatal to chickens, 50% fatal to humans. Oh, that's a bad statistic, but luckily it didn't get too far. Seasonal flus, 36,000 deaths a year. I've seen upwards of 60,000 actually. So coronavirus, we're over 130, and that was last I checked when I last made this slide a couple weeks ago or a week ago. So we're climbing fast, though there may be some hanky-panky with the numbers. We don't know. Risk factors are contact, home, schools, immunocompromised. Winter, of course, people are indoors more exposure to each other. We're coming up on one of those with this one. Infected birds and bats, and there's the birds and bats thing. Allopathic symptoms. It actually looks like other coronaviruses have passed to us from, of all things, camels. Greger did a great series on this. Go look up his series on pandemics. He actually is a kind of a pandemic expert, and he said that when there was a study that said that people were catching coronavirus from camels, not this coronavirus, but a previous one, he said that they started a campaign with camel owners, and it's called "Kiss Your Camel" campaign. Because they were saying, "Hey, stay away from camels." No, we love our camels. Kiss your camel. I thought that was pretty funny. Not making that up. That's funny. And let's see. So they evaluate basically for common cold or flu, trying to figure out, because they don't want to hammer you with antibiotics that won't really do much for viruses. So, but cold's a virus too. So I guess antibiotics should be out anyway. Evaluate for pneumonia, of course, and then go down that road of pneumonia type drugs if you need it. Again, the immune zone for us. Let's see, large intestine, stomach channel. So it's all kind of the same, right? All these just slightly different versions, okay? So vaccines, when they're matched, look to be 75% effective, though how often do they get it right? I don't get them myself. self-limiting. Antivirals, if you catch them soon enough, you might be able to stop a flu within 36 hours. But oftentimes you don't even know you've got it, right? So you're past the 36 hours before you even got symptoms. Pain relieving NSAIDs you can use. So basically, you can look at the upper respiratory infection slides for points and channels and treatment because it's all basically the same. The only thing I might say is that we might be treating more like neck and shoulder because we've got other channels involved, right? So as we look at that head and neck area, we might be going up the back of the head. We might be needing more of a headache kind of points. So look back to other seminars on upper back, but really quick for specific points, we're going to go, everything's opposite clock. So gallbladder channel here, up the trap, opposite clock heart with gallbladder. So heart 4 to 7 are going to be your points. They're needled from the side in the way I like to do it. Small intestine channel is going to get liver, so liver 5-4 area. Spleen channel going to get triple warmer. Triple warmer going to get with spleen, so you're going to needle spleen 5, kind of liver 4 area. Spleen 5.5 more for that levator scapula insertion over there, which is that sort of red snake head, right? See that little snake head over there on the levator scapula on the superior angle of the scapula that not everybody has on top of their scapula. Yeah, to me that's triple warmer, which we treat with small spleen 5.5. So it's kind of a low spleen 6. Bladder channel here on the back of the neck, going to get it with lung points. So lung 7 to 9 area, lung 9 up there more the occipital area. And then as you come down, lung 7 is going to be around C7T1. Heart 4 again, that same C7T1. Heart 7 going to be way up here at the neck. So 5 and 6 are going to be sort of mid-neck on the gallbladder channel. If it's right on the GV, you could do CV points, but I wouldn't recommend it being that they're over the throat. So we use Achilles tendon typically. Those Master Tung Achilles tendon points are wonderful for treating cervical. But again, we're kind of getting outside of flu here, but that's just what you would do. That kind of covers all the channels. Large intestine's the last one. On the front, the white channel is large intestine. So large intestine, opposite clock, kidney. That's why that kidney 4 to 3, and then even all the way up to 7, if you're down towards the front of the SCM where it attaches at the sternum there, sternoclavicular. Okay, good on those zones, guys. Okay, on we go. Herbal treatment wise. Resveratrol again, cold, hot deficiency. Lonicera complex, of course. Great formulas again from Evergreen. Herbal ENT, herbal AVR, specifically viral, and that's their viral formula that I really like. So I'll even use that AVR on those colds, the upper respiratory tract infections, because those are viruses too, right? So it's not just flus that are viruses. Xiao Chai Hu Tong, that would be your in-between stage, your Xiaoyang disorder, right? Your classic TCM of 6th stage, if you will. So when it's the alternating symptom, right? So when it's the achy and then not achy. It's the achy up the neck and muscles. Then I usually go to the Xiao Chai Hu Tong. Sometimes I'll use it with ear because it's one of the few that'll open up triple warmer channel, specifically Xiao Chai Hu Tong. So I'll use it on ear issues, ear patients, ear infections, Meniere's disease. I like that Xiao Chai Hu Tong. Good formula. Yuping Fengsan, of course, tonifying when they're not having the condition, if they're catching them over and over again. Mayo, I'll get back to that in just a second. The diarrhea aspects of COVID-19. Yuping Fengsan and Gan Mao Ling, of course, Yin Chao, Banlan Gun Tea, we talked about all those. So diarrhea aspects of COVID-19. If they're having a digestive piece to it as well, I think that's the immune/GI piece, and it's just affecting the GI system as well. So whether the virus itself goes down and causes GI, some patients get the GI, some don't, it seems like. Then we just treat GI, so if it's an acute GI problem, I like Culing formula, which is curing pills or Culing Wan. The old school version, the Yang Chun brand was my favorite. I think Solstice carries it. That's one of my favorites. Though Hoxiang Zhengqitang is a great, summer heat kind of dampen the intestinal. Xiao Chai Hu Tong is a possibility. Just straight up ginger tea I like a lot for any kind of thing like that. Yep. Let's see, acupuncture. Do we give acupuncture sex infections? I give acupuncture. I haven't been treating anyone with an active flu or cold or symptoms currently. So I'm avoiding those patients and letting them kind of be on their own. I might give them herbal dietary stuff and have them come pick it up or mail it or whatever. But I haven't been treating them in-house. I just don't want to expose the rest of my clinic to somebody that we know has some kind of infection. I mean, if they're tested to not have it, and I think the test was accurate and enough, then I would probably accept them. But otherwise, I have enough risky patients with one lung, post-cancer, MS. I just don't want to. I mean, wouldn't we all feel bad if somebody got it in our office, and died? That would be terrible. Let me see if there's any other questions I missed here. Yeah, stomach flu we covered in GI stuff. So sorry, we won't cover it today. It's kind of a long. Basically, you ate something with bacteria in it. So usually it's meat. Usually it's chicken or beef or something that's been polluted with fecal bacteria from. It's food poisoning. It's a food poisoning from fecal bacteria. Chicken's the worst. They've done studies and they've swabbed people's kitchen sinks and then swabbed their toilets and then grew the stuff, and the kitchen sink is way dirtier than the toilet was because people are washing their raw meat in their kitchen sink, and really no amount of cleaning gets it out. I mean, you could clean room the thing and you can't get rid of all of it. It's that stuff is toxic. So I stay I stay a long way. Great. Post-COVID. I haven't treated post-COVID yet, and I haven't seen anybody that's had it and had symptoms to treat. I guess Oregon, we're not really heavily hit. I think we've had a couple hundred deaths. So I have yet to actually have a patient that I know of that's had it. I have family members of patients that have had it, but no patients, and no one that I know has died. So yeah, so I would treat it just the same. I'd probably go herbal, especially because if people are getting the post ear kind of thing or post can't smell kind of thing, we're going to need herbs to open up that kind of thing. My favorite herb opening up ear is Shirchong Pu acarus. It's one of those open orifice category herbs, one of the only ones that isn't toxic and impossible to get. And I usually use Xiao Tong and then add acarus to it. And then that combo gets it in there and then opens up that eustachian tube and drains, and then usually hearing comes back for those kinds of patients. Not do local points. I do not. No, Tracy, I don't do local points. I might cup locally, soft tissue work, stretch. I might have them move it. I'll give them yoga moves, stretches, that kind of thing. For me, it does. Yeah, especially pain. You put those distal points in, and it is instant. I mean, for me, I could give you some percentages. So without counting, I think I get about 75% instant relief from things I treat. Not 100% relief, but at least 50%. So I get at least 50% change immediately as the point goes in, if I got the right spot. If I didn't get it, then I keep checking my point, checking my stimulation, checking my depth, angle, the whole thing. There's a whole bunch to the technique of it, of course, which is why demonstration is really important. But so I'm looking for that. I think I help up to 90% or more. They just may not get the instant change. And usually those are the patients who don't feel, they're not in their bodies enough to notice the difference. They're just, checked out. It hurts so much, they don't even want to think about it. So I go, well, I want you to think about it and tell me whether it's better or not, because I need to adjust my treatment if it didn't work, right? Okay. Yeah, I guess you could use Lingua Dabai for immune. Building the baby's biome. Yeah. 2 post-COVID week-long responded to acupuncture versus only acupuncture. Yeah, I'd say herbs too. I would want to tonify. Oh, favorite lung tonification, which we might get to in a couple. When I cover lung cancer, we'll get to it. That might be tomorrow, though. So just really quick, it's called Qi Guan Yen. I might type that in really quick. Qi Guan Yen Wan. And I like that for really old, chronic, weak lungs. It's very tonifying, transforms, suppresses, opens the lung. It's a very useful formula. And I'm using that for emphysema patients or, quit smoking long ago, still can't breathe. You give it to them for a couple of months. It's like they're like a new person. I've seen it do just miraculous things. So better than any of the treatment I gave them. Okay, lifestyle stuff for flu. See the URI stuff, same thing, viral. Green tea, 3 times less flus in healthcare workers who drank green tea regularly. I think this is probably Japan because they drink so much. And I think the people drinking the most green tea, we're talking like 6 cups a day. It seems to increase the T cells, which is pretty cool. So that seems to be its function when they do the research, specific research. Okay, done with flu, done with infectious stuff. On we go. Food allergies. We got another 20 minutes or so. Let's see if we can roll through this. I wonder if I could see what slide number I'm on. Any way I can do that? Well, I won't worry about it. Let me just click ahead and see where we're at. Oh, awesome. Hey guys, we're almost on time. I can't believe it. I got a lot to go through with food allergies here, so this will probably take the whole 20. But if we can get through lupus by lunch, I would be happy. All right, food allergy people, here we go. So basically, anaphylaxis is the big deal, right? Eggs, peanuts, dairy fish, shellfish, tree nuts. Those are the ones that really kill people. Basically, they can't breathe. Have to hit with the EpiPen. But other food allergies, the ones that we see that come in, I don't really try to treat those other ones necessarily. I just try to have them avoid these things and give them, kind of your basic diets and we see if they can get better. I haven't seen any that tried the anaphylactic stuff after they did the, treated them for the food allergies. But the more general ones where you're seeing, eyes, nose, throat, skin, GI effects, those kinds of food allergies are really common. IV exposures tend to cause more severe reactions. So if it's somehow in a needle, there's like egg whites in vaccines, right? So they inject you with the vaccine and then boom, you get an egg white reaction, or you develop an allergy to egg white, something like that. Proton pump inhibitors, H2 receptor blockers, they seem to increase the reactivity, which is interesting. I didn't know that. Basically, allopathic medicine, they're going to do skin testing. Not that effective. IgE levels, double-blind placebo-controlled. Food challenges. I do like food challenges, and I do like food elimination. We'll talk about fasting and elimination and how you can try to figure that out. I do not have any idea of a point that would work as good as an EpiPen. Not even close. I'd say hit it with an EpiPen and then do what you can while they're call the ambulance and whatever. Okay, on we go. So food allergies, we're talking mostly digestive here. So again, the main channels we're dealing with: stomach, kidney right in the middle, stomach to the sides at the intestinal level, spleen a little farther out than that, and that's pretty much it. Large intestine, of course, internally. As we go on here, hara, immune. So stomach, spleen channel. As we're looking at the abdominal areas, of course, immune area, but it could be anything in the abdomen. Since they're having a food allergy, usually it's GI as one of the main symptoms. So it could be everything, all the areas. And so to someone else's question, I'll just treat them all. If I think that one is like if we palpate spleen in the center at the navel level, and that's tender, and they feel it radiate over to the large intestine on the right side, say, for example, and then you go palpate large intestine and there's nothing there by itself, I don't necessarily treat large intestine just because it refers over there. I'll still treat spleen because that's the source of what's sending the symptom, right? So I treat the source thing. I don't necessarily treat. If it didn't go away, then I would probably go and try to find the point that treats that, which would be the stomach 36, 37. But the spleen 9 should get it. And if it didn't, you maybe need a second point at spleen 9 or different angle, deeper, more stimulation, etc. Liver crossing, a common spot for these patients. Pulse-wise, you might find it large intestine organ, small intestine organ, stomach organ, stomach channel maybe, and it could be superficial, it could be windy, it could be tight, it could be wiry, hesitant, it could be weak. It could be bloated and so there could be all kinds of things in the pulse on these cases. So there isn't really a straight across easy, like, oh, this has got to be food allergies if you have this. It's a little hard to tell because it varies by the symptoms. Basically, the medical profession is going to say avoid known foods, use an EpiPen, antihistamine, steroids, desensitization shots. My dad did those for years, and it didn't seem to help a ton. Let me look at these. Gluten-free matcha tea, blueberry, raspberry pancakes each morning. Sounds very delicious, Mr. Christo. Food allergies manifest as sinus congestion. Right, we're going to get to that, Jacqueline. The food allergies that manifest as sinus congestion. Mushroom and olive, I don't know what that means. On we go. Channels and images. So we're looking at spleen channel, stomach channel, right? Those are right over the organs themselves. Large intestine channel internal, of course. Small intestine channel goes to its organ a little bit. I don't think as much. I usually find small intestine organ treated best with spleen points and herbs than treating small intestine channel itself. So like needling up the small intestine channel doesn't really seem to get as much of small intestine issues. Though, if you look in the Tung system, you've got Shinmun, heart gate, Ganmun, liver gate, and Changmun, intestine gate, all along the small intestine channel. So there's intestine gate right there. Though I would say that I find the spleen and stomach points to be more effective for me. But if I was having trouble, I'd probably try them. Let's see. Here's our points. Kidney channel, of course, there. CV, front to back. If you had it right in the middle and it wasn't going away, I'd probably try a GV point, but it's kind of rare. I don't use those a whole heck of a lot. Stomach 36, 37, spleen 9. So these are hitting all the zones, right? Stomach 36, 37 on the same side of the large intestine zone. So right side, large intestine zone, stomach 36, 37. Left side, large intestine zone, left side, stomach 36, 37. Spleen 9 for that middle spleen zone. Spleen 9, same side as the upper spleen zone on the upper left quadrant, right? Spleen 4, liver 5. For that liver crossing, same side, or the liver itself, same side, right? Either one of those. Li4 classic, that's also kind of a middle jowl area if you use that little microcosm there. Li10 classic for treating the immune zone. That's why we see the triple warmer in parentheses. That's to remind you that it's Li triple warmer combo area. So it's kind of the in-between triple intestine 10, if you will. Triple 1-5 PC6, we talked about that one already, being lower abdominal and chest at the same time. And then, of course, GV20 can get top to bottom. So if there's a hemorrhoid kind of a thing, or if there's just a spleen sinking, I do like that GV20 for that sort of lifting function that it has. Still using those. Herbal treatment, GI tonic is excellent. It's kind of a similar formula to maybe a Culing, something that's going to just treat your acute kind of a symptom or general disorder of abdominal GI stuff. Sejunzatong, Liu Junzatong, these are my favorites. Liu Junzatong is probably my most used formula of everything. I love that one. 4 gentlemen with a little bit of Chen Pi and Ban Xia in it to help deal with the dampness, which everybody seems to have. If their tongue starts drying out, I switch them to just the Sujunzatong. And if it's really thickly coated, then Xiangxia Liu Junzatong, right? Because then you added Xiangfu and Sharan. So it's even more transforming damp for the Xiangxia. That's the really thick, greasy tongue coat. Scalloped, puffy, greasy tongue. Xiangxia Liu Junzatong. As that coat starts to come off, the scallops recede a little bit, switch it to Liu Junzatong. If the coat gets to the point where it's totally dried out, which is pretty rare, then all the way to Sujunzatong instead. And it's just focusing on spleen tonic at that point. Buzhou Ichitong, of course, tonify qi, raise the center. Shenling Baijusan for those really like diarrhea, damp, tons of sinking. I've seen Buzhou Ichitong, in fact, treat prolapse. In fact, that's the formula that I like to treat prolapses with. So if a woman is having, prolapsed bladder, prolapsed uterus, prolapsed intestines, hemorrhoid could be a prolapse of some kind. You give them Buzhou Ichitong, whoop, it just lifts it right up. I love that. It's like an herbal sling, kind of to lift along. Oh, olive and mushroom allergy, Anjali. I see what you mean. Okay. Specifically olive and mushroom. Gosh, that's tough. Those mushrooms are so immune boosting. I might wonder, if it's yeast too, is there also a yeast allergy? If so, then you're looking maybe at Crohn's, or early stage of Crohn's where it hasn't really developed into everything else. But otherwise, desensitizing it is tricky. I think as if they clean up their diet enough, which we'll talk about that in just a second, it might ease down the allergy over time, and then they can have some of that without it being terribly, not to yeast. Wow, that's unusual. Yeah, obviously you're going to avoid them, and then try to clean up your diet as best you can, and have as much of an anti-inflammatory blood as you could, which would be, we'll talk about. So that's those two cooling pills I talked about earlier, and ginger tea I give to anyone with digestive issues, unless they are really, acidic. And even then I might give it to them, depending. On we go. Lifestyle and nutrition on this. So 5 to 10% of children have food allergies, 2 to 4% of adults. Many children outgrow them as they age. Mine have to some degree. Our daughter was allergic to a number of nuts, and now it's just but kind of a rash she'd get, and that's lessening over time as she ages. She's now 7. My kids we did a lot of soy when they were young, and so they were getting a little bit rashy from soy. That's gone away. Now they can eat soy and drink soy milk and stuff, and it doesn't bother them. So they've outgrown some of theirs. Sensitization may be reduced by late introduction of potentially allergenic foods. Avoid with parent allergies. So you'd want to avoid any parental allergies. So like if I'm allergic to something, then I would want my kids to avoid those foods for quite a while into their adolescence, and then we can finally give them foods. As babies, of course, there's a ton of things to avoid. I'd look to Dr. Furman has a good book about childhood immune and allergy and keeping your kids really healthy. And he's got a whole list of things that he says, no nuts until they're 2 and no eggs until they're 1.5. And he's got it listed out at what age you can incorporate which foods to avoid the allergy response. So I'd look to him, Dr. Furman, Furman. He's got a good book on that. And a whole bunch of great recipes and stuff in there. Let's see, food allergies, common allergens, egg, of course, milk, egg, peanuts, tree nuts, seeds, wheat, soy, fish, shellfish. So I would say if somebody has allergies, avoid those 9 to start with and to see what happens, clean up the diet. Omega-6 seems to be, it might increase the IgE and leukotrienes, increasing allergic response. So the omega-6s seem to increase, and those are mostly found in meat and animal and nuts have a higher 6-to-3 ratio. So you want to avoid, some vegetable oils are really high, margarines, that kind of thing. So we want to avoid those for people who are having allergic responses because their IgE levels, we want to get those down, right? Get those homocysteine levels down, the inflammatory response we want to reduce, right? So these are dietary things we can mention to them. Reduce the likelihood of allergies. So breastfeeding past 4 months helps prevent. Early cow's milk introduction seems to, of course, bring on allergies to dairy or formula triggers IgE as well. Delayed introduction of allergenic foods, of course, like we just said, and then avoiding processed foods. So a whole bunch of the stuff that goes in the processing and a whole bunch of the stuff that preserves the foods are allergenic producing and just really unhealthy stuff. So as we continue on, allergy avoidance diet for breastfeeding women also reduces childhood incidence, specifically eczema. So if mom stays away from those foods, it doesn't get into the breast milk, it doesn't go into the baby, and then the baby doesn't have the reaction. So you can even give mom medication. Like you can give mom the herbal formulas. Like I've given kids with lots of eczema, you give mom like Xiao Feng San, one of the like wind itchy formulas, and then through the breast milk into baby's eczema gets better. I love that. Of course, I'm also having mom avoid eczema-inducing foods, right? Points-wise, again, we're just treating. Usually I take it as somebody's asking about points for the food allergies. I'm treating the intestines because that's where the food is going and that's where the immune system is responding to it, right? So I'm going to treat intestinally, which was all the points we listed. So you palpate around the abdomen, you find out where the areas are that are affected, which is usually small intestine, large intestine, and then you treat those zones. So basically, it's still your spleen 9, stomach 36, 37. It's just in addition to, hey, here's the whole bunch of lifestyle stuff. So really no magic trick, for a point for the allergies other than, treat what shows up, really. Good. That was mom. Avoiding milk and eggs seems to reduce eczema specifically, and a lot of kids are just outgrowing them in a couple of years. Meat is associated with more allergies in children, and there's a study on that. Go look it up. Eczema, specifically eggs, milk, wheat, most common allergens. Irrelevant of skin tests. And then this goes back to the skin testing, not so accurate. So even if somebody shows, oh, they did a skin test, I'm not allergic to that. Not necessarily. You still might be. Or, oh, they did that, I'm totally allergic. Maybe that day you were, but it doesn't mean you always are. Or just because the skin reacted doesn't mean your internal reacts, right? So here's a baseline diet. Here's an elimination diet by Physicians Committee for Responsible Medicine. They wanted you to hit brown rice, white rice, puffed rice, cooked and dried fruits, green, yellow, orange veggies, plain carbonated water, and modest amounts of salt, maple syrup, condiments, and that's it. So that's your baseline diet. And then they, when the dermatitis has reduced after a week or two, then you start a food diary and you add back foods sort of one at a time in generous amounts every 3 to 5 days, looking for reactions. And once you react to one, now you know, right? Yep. Also, if there is eczema happening somewhere or in particular, we'll cover that when we get to a little bit more on the skin dermatology stuff. We just treat that area. So if it's on the elbows, then you go just as if it was pain, go to the knee treats elbow, so put needles around the knee, skin gets better too. Whether it's a rash, pain, numbness, tingling, discomfort, I mean, it could be neuropathy, it doesn't matter. It's a locational treatment, it treats the spot, right? Common allergies added last. Again, on this diet, if you have a reaction to something, you'd avoid that for a couple of weeks and then add it back in and try it again just to see that it wasn't some off thing. If it's anaphylaxis, then probably they should be supervised medically by maybe an in-house kind of fasting. I would recommend a fasting clinic where they're being watched by physicians. Another great book, Dr. Bailey has a book. He's actually a naturopath here in Portland. Was last I checked anyway. The fasting diet, he calls it. He has an excellent explanation of what happens in the immune system when you eat something that you have an allergic response to, and why it becomes kind of like an addiction to the thing you're allergic to. And it has to do with the immune system reaction. So you eat something you're allergic to, your body creates a bunch of immunoglobulins. It creates more than it needs. So those immunoglobulins gobble all it up, take care of what you just ate, but there's still immunoglobulins floating around looking for things to eat. So they start attacking you. That's the autoimmune piece. And then when you don't feel good with the attacking, if you eat more of that food, the immunoglobulins now have somewhere to go and they stop attacking you, you feel better. So you become actually addicted and feel better when you eat your allergic food. Crazy. The way you break it is by going on a fast, completely avoiding all those foods. And then when you add it back, now you feel a huge response to the food reaction. You're like, whoa, I feel terrible eating that. Done. It's out of your diet. So, Christo, no, I don't work with blood type diets. So, yeah. Good question. Thanks for asking. What was the T for breastfeeding moms? Oh, it was. It's just a Xiao Feng San minor wind formula. It's just your basic formula for wind for treating babies through mom. But you could give mom any. I mean, if she had if it was a damp heat thing, you could give mom a damp heat formula. You could give her anything. I mean, it'll go whatever needs to get to baby. We'll make it through breast milk. We'll get into her now. We might be careful with some toxic type substances because we don't know if everything is safe, right? There might be some things that make it through to baby that we don't want getting through to baby. Same thing goes with pregnant women. There may be things making it through placenta we don't want going into placenta. We'll talk about that when we get to pregnancies and gynecology. Yep. Taurine, I don't use, Jennifer. Elimination foods up again. It should be in the slides, so you can you should be able to go back and get them. You should have been emailed the things. Rice and fruits. Not sure the question, but yeah, they had that in there. It was brown rice and fruit. Yep. Okay, so for the fasting diet, basically, he has you cut out everything and do a juice fast, and then he has so you eliminate everything for 5 days. What happens is your immunoglobulin inflammation level drops. So now when you eat that allergenic food, you get a huge reaction. It's like the difference of traveling 50 to 55 miles an hour versus 0 to 55 miles an hour. You'll have that huge change versus a slight change if you've been eating it regularly, right? So sometimes you just can't tell how allergic you are to something until you've cut it out for days and your immune system is calmed down by some kind of a fast. So I will have a lot of my patients go through kind of fasts on their own, depending on the level and disease and how much I'm worried that they can do it. So this kind of goes through, and I'm going to skip through most of this, you guys. You will feel free to go back and read it, and go get his book and read it there if you like. Again, a fascinating discussion on how the IgGs and IgEs and IgMs work and how all that comes about. It's really interesting. It finally made sense to me after the way he explained it. Okay, and here's the cellular levels, allergy addiction, and great. So here's what he has you do. Increases. So allergic symptoms that you might look for are increased heart rate, shortness of breath, rash, lightheadedness, fatigue, heart palps, stiff and achy. Some people will just take their heart rate. They'll look for increased heart rates, and then they go, oh, I'm allergic. You just eat a little bit of something and check your heart rate before, and he has you do it 30 minutes after, an hour after, hour and a half after, 2 hours after. And when you check it that often, you'll see, oh yeah, it's going into my bloodstream. I'm having heart rate go up, and then it's there for about an hour, and then it drops off. Wow, I really was allergic to whatever. And then you eat it again, it goes up again. Very interesting. Okay. I'm going to finish through, and then he's got his liver. I put the whole series of kind of how to do it summarized in here. How to go through the flush, day 1, day 2, day 3. He wants you to do kind of enemas to keep the intestines going and to flush out any kind of toxins that might be in the intestine. Other versions, they have you do a saltwater flush where you drink a saltwater concoction and that empties out your intestines. Usually I like that one personally, but that's on a full water fast or a lemonade kind of fast. Okay, we're on to lupus. I guess we'll have to be a little bit late on our lupus to go to lunch. Let me see if there's any quick questions before we run off to lunch here, guys. Oh, so Kelly, the time frame for how fast heart palps, it's I think within 15 minutes. So you could even like take your temperature, take your heart rate, eat the food, wait 50 minutes, heart rate again, 30 minutes, 60 minutes, an hour, hour and a half, like that. So you kind of take it at various increments and see. That's a really good way to tell. But other things might come up instead of that. I mean, you could have a headache with it. You could have a eczema with it. It may not manifest as a heart thing. Okay. Yeah, let me just see if there's more. Show immune areas on abdomen. You mean just in general with each time we cover it, or the chart again? So stomach zone is basically stomach 12. Large intestine zones are either side of navel. Navel's right at that spleen middle zone, and so that's kind of where you're going to find most of your issues, intestinal issues, because that's the middle of the large intestine, ascending and descending colons. That lower liver on the left-hand quadrant is the sigmoid colon, and occasionally you'll find it on kidney as sigmoid too as it goes out, but usually it's behind everything, so it's too deep to palpate there. The lung zone is where the appendix and the ileocecal valve is, also ovary, also psoas muscle. So there's a lot of things happening right there. So sometimes it's a little tricky to know. Immune, same as lung, yes. Yeah, I think full water fasts resolve a number of problems. For more information on that, see True North Health Center, and they've got Dr. Goldhammer. Dr. Clapper actually came from True North Health Center. He was there for years. If I was having an issue that was complicated, I would basically go live there. That would be what I would do. Gilbert syndrome. Oh yeah, that's right. I was going to look that up. Let me write that down. Thanks for the question, Anjali. What is that? Dr. Tombach. I'll look him up. Thanks. True North Health Center. I'll try to find a link for it and put it up after lunch. They're in Santa Rosa, just north of San Francisco. Great wine country. Okay, guys, I think we'll go for lunch. Yeah? Any last words? Any last words, Donna? Come back at 2 o'clock or so? Sorry, nothing specific for psoriasis. I would just treat where it shows up and definitely look for allergies. Usually I find that that's allergy related, food allergy related. So look for food allergies, and fasting's the best way. Oh, you have a friend there now, Nadine? Awesome. That's it, True North Health Foundation. They're doing lots of research there right now. They've got their own lab they just put up. Fascinating stuff, amazing things. Have a good lunch. All right. See you guys in about an hour.
So I'm going to just share his website with you.